Good morning, everyone, and welcome back to CHISEL Healthcare InnoMatch 2025. I'm Hon Tim. I'm the Clinical Director for the Center for Healthcare Innovation, or CHI. That's where you all are sitting now. And with me is my wonderful co-host and my wonderful colleague from CHI, Casper.
Yep, and today we'll be your hosts for the event. And actually, we also think that today will promise an exciting showcase of groundbreaking digital solutions that could transform patient care as we know it. So, whether you are joining us in person or online, we're very excited to have you with us. So, it's really my honor to be co hosting this event with Hon Tim. And this, of course, is the final pitching event of CHISEL 2025, organized by the Center for Healthcare Innovation, presented by Temasek Foundation, and supported by the Ministry of Health.
So CHISEL is also very much a partnership with the three healthcare clusters. And so with NHG Health and National University Health System and Sing Health, CHISEL InnoMatch is truly a cross-cluster, all of Singapore platform that's convening the key providers in our healthcare system to accelerate the adoption of ready-to-market solutions from startups and SMEs.
And if you do not already know, CHISEL is already in its fifth year, and it is the Global Innovation Challenge that invites participants to pitch their market solutions to win the opportunity to receive funding to test bed their solutions with public healthcare institutions and all their community partners.
So we really can't believe that it's been a half a decade already. So we look forward by the end of this event today for new additions to the 16 test beds that have already come from CHISELs in the past, which have actually also received a total funding of $6.7 million to date.
And thank you to our sponsors for that. So this year, our theme of building a digital health for the future has engaged over 500 interested innovative companies from 58 countries.
It's a new record for us, and it's a remarkable global response. It shows that when it comes to innovation, there are no borders, really.
That's right, exactly. And from these exceptional submissions, we have actually narrowed them down to the 10 finalists who you'll see this morning, and they will be competing to win from a total share of $3 million test bid funding. So each of the each of the winning solutions today will receive up to $500,000 Singapore dollars to conduct their test bidding with a public healthcare institution.
So it's going to be a tough job to select the best of the best, but that's the job of the gentleman in front of us.
Yes.
So I'd like to now to introduce our esteemed panel of judges. They bring a wealth of experience and expertise and perspectives to this table. They really have a challenging task of selecting the standout projects from our finalists today. So let's get to know them a little bit more by inviting each of them to briefly share in about 1 minute, gentlemen, your insights to healthcare innovation space.
Yes, and we will actually pose you the question one by one. Okay, to start off with, we have Mr. Kee Kek Chuan, Head of Health and Wellbeing from Temasek Foundation.
Welcome.
Right, welcome.
Thank you. Thank you for...
Right. Okay, Kirk, the question to you is, what kind of impact would TF like to see from CHISEL InnoMatch?
Thank you for the question. That's difficult to answer in 1 minute, but I'll try. Okay, but I think I'd like to just start by a quick recap on why we decided to support healthcare InnoMatch. So our intent was really quite straightforward, to encourage the public healthcare sector adopt more innovative solutions that can improve patient outcomes as well as reduce costs. So really, for us, what makes InnoMatch unique is that the prize funding is directed towards piloting solutions, right? Well, with the finalists as well as the healthcare clusters. And we feel that this approach is a very good way to offer proof of concept and demonstrates value and create a pathway for scaling, right? So that is what we are looking from here. And we're really excited. Over 4 years, there have been 15 winners. 4 solutions have already been scaled. So my board is really pleased about that. And you know what's really exciting is that the winners, after being awarded the prize money, have gone on to attract more than 36 million in follow-on fundings from other funders. So I just like to end by thanking the partners of this, and I wish the finalists every success. Yeah.
Thank you, Kirk. Temasek, one of our strongest partners all this half decade, really. So thank you very much, Kirk and Temasek.
Yes, and really thanks, Kirk, for also sharing what we have shared as well in terms of what's next after they finish CHISEL.
CHISEL will evolve,
Yes.
right? Okay, our next three judges are actually from our partner healthcare clusters. We're really honored to have the three CEOs from our three flagship hospitals in Singapore. All right, Casper, over to you.
Yes, and let's extend a warm welcome to our first judge from our partner healthcare cluster, Adjunct Professor Tang Kong Chun, CEO of Tan Tock Seng Hospital, representing also NHG Health. Well, welcome, Casey. And our question to you is this: what are the key considerations for a large hospital to successfully adopt and integrate market solutions into clinical workflows?
Thanks very much for inviting me to be on the panel. Indeed, it's a very challenging task to go through such good entries and proposals. But I think when we look at all these market solutions, the first thing we have to always ask, is this a solution looking for a problem? Or are we really having a problem, a real world problem that needs a good solution? I think the first thing is the use case. Second criteria or condition that we have to look at is, of course, the business case, the cost of implementation, whether eventually we are going to have to charge the patient for the use of this solution, and also how that sustains itself in the long term. Third thing on our minds as three CEOs is how it integrates with the existing EMR systems that we are using, because Singapore is now going for one common EMR, which is Epic. So how does this integrate seamlessly with Epic? And if not, then there will always be a problem. And of course, the last condition, in a sense, is that there must be a continuous process for review and improvement, because we know that a market solution, as it comes in, it would just be probably like viable for that point of time, but how does it improve? Just like our iPhones are always getting, upgrades and all that all the time.
Right.
So these are the four areas that I will look for in assessing the solution.
Great, thanks, Casey. I think if the finalists are listening in, I think that's a preview of some of the tough questions he's going to be asking you. And also thanks for shedding a light on one of the biggest pitfalls of innovation, which is putting the solution before the problem as well. Okay, over to you now, and welcome back to the CEO of NUH, that's Prof. Aymeric Lim. So Aymeric, NUH has taken, of course, a lot of adoption of new innovations. Does any particular story stand out for you where the adoption of a solution brought great value to your system?
Yes. Okay, there are many, many apps out there and innovations.
Yeah.
So for example, in NUHS, I think we probably have 120 on the radar, and only probably about 10 or 12 are in production.
Right.
So I think that our best app is actually a platform. It's the NUHS app, which is a patient institution interface. So 14 institutions seamlessly across them, 1.7 million downloads, and 28,000 daily users.
Right.
So it's and it helps with the billing. It really good for the billing also. So but patients can access their records, get their MCs. I mean, it's a brilliant app. So I would say this, in terms of practicality, it's the most useful that we have. I just want to say one thing though, I think for all the institutions here, innovation isn't something that's good to have. It's a survival thing.
Yes.
It's a necessity. So I think your platform is really important. I thank you for inviting me to be here.
Great.
Thanks, Aymeric. All right.
Thank you so much, Aymeric. And we've been hearing some common themes now. We're hearing about patient outcomes, making sure our patients have access, and also to ensure that there is certain savings and effectiveness in terms of how we use innovation. And now over to the Sing Health representative, we have Prof. Tan Hyang Kun, CEO of Singapore General Hospital. Welcome, Hyang Kun. So our question to you is this: hospitals are really scarce on time and resources, and we see a lot of new innovations coming in. So how do you prioritize the adoption of these new innovations against existing competing demands?
Well, thanks for inviting me. I think every institutions would already have determined what their peak of excellence would be.
Yes.
This is largely driven by historical competitive advantage. It could be the population they are serving. So I think it is important that the adoption of these solutions are aligned with what the institution will want, and everyone could have a different areas and domains that they want to pioneer. The second part is about feasibility, and that could be financial, this could be system integration, whatever the cost may be, the solution would have to be feasible and sustainable. The third, I think, is very important. You need to have champions on the ground to do this. And champions not just in terms of the clinicians, whether you are doctors, nurses, allied health, but also champions in the admin support, that the clinical ops support that allow you to carry this through. And I think if you integrate and align this, it kind of already sieve out maybe 70, 80% of solutions that you may not want to pursue. And the rest is about who then has the best merit to win the competition.
Okay, great. Thanks, Yang Kun. That's prioritization for you. Thank you. So moving away from our cluster judges, we now shine the spotlight on a very strong ally of CHISEL as well, Mr. Glenn Neo. He's the Director for Innovation, Capabilities and Enablement from Synapse. So Glenn, Singapore's healthcare system, especially IT, getting a lot more complex. What's one key pitfall that our finalists should avoid if they want to integrate their solution into our system?
Thanks, Hong Tim, and congratulations to what looks like a very amazing event at the start. So my response to that actually has been briefly repeated by Prof. Casey and Prof. Yang Kun. The orientation around what is the use case, how do we ensure that the value equation can be addressed, how do we make sure that it is cost sustainable. So maybe my additional input to dive deeper into that is that of all the young innovations solutions that I've seen in the last 7 years or so, this is a very common theme and a very common pitfall. That is the underestimation of complexities. And they typically fall into two categories. One is the failure to understand that Singapore public healthcare construct can be very different from other countries and can also be very different from other industries within Singapore. The multi-entities construct does bring complexities that needs to be addressed. Second is the underestimation of policies, compliance to them, cybersecurity, and data protection. We take this very, very seriously, and the leaning forward posture that we offer to participants of this event is that there are actually a lot of resources and a lot of support and a lot of enablers made available to help people, help solutions discover some of these gaps as early as possible. And the merits is this: the later we discover the gaps, the later we get fit, the more expensive and the more costly and the more time it is going to take to address them.
Yes. Indeed, indeed. And if you like what Glenn is saying and you resonate very closely with him, actually he has done a full 30-minute presentation earlier this year in March on the exact same topic. Right. So, do catch him after that if
Indeed.
you'd like to find
the
out.
People over there, some of the competitors are actually in the audience with us now, listening very intently to all this as well. Okay, thank you very much, Glenn, for the tips.
All right. And okay, of course, last but not least, let's welcome Mr. Lim Cherwee, Executive Director from the Ministry of Health's Office for Healthcare Transformation. So Cherwee, sitting at that level, having the oversight of the healthcare ecosystem, we'd like to hear from you. What will enable spread and scale of innovative solutions across the healthcare ecosystem?
Hey, thank you, Casper. Good morning, everybody. Thanks for having me here as well. I think obviously the solution itself would have to be seen to be delivering value. I think this is something that all of our panel judges here have also been speaking about. But apart from that, I thought one other area that I could talk about a little bit more is really around how we should try to build trust with evidence. The idea here really is that as we build evidence to value to clinicians and also to clusters, we can, where possible, build confidence. And with confidence, we build scale. And also just to repeat one last point that I think the judges have also been speaking about quite a fair bit. While each of the solutions that we're thinking about here are disruptive in and of its own right, it is important also to really recognize how the way it is integrated and maybe generalized can be done so with minimal friction. So how might the solution, for example, plug into a set of care relationships within the site or maybe with the ecosystem? How would the solution perhaps avoid some of these issues with regard to additional workflows, additional manpower, additional financing? I think these are considerations that would, where possible, if avoided, help us to allow for better scaling as well as spreading of solutions.
Right.
Thank you very much, Shuri. Yes, secret juice would be trust, and someone wise once said that change moves at the speed of trust. So thank you for
Actually,
that.
I wonder,
Yes.
after hearing from all the judges,
Yes.
whether the finalists will be thinking, I should have changed my pitch.
There's still a little bit of time to do some audio changes when you present. All right. So thank you very much, Joey, and another round of applause to thank our judges for being here. They've got their job cut out for them. So you may have noticed that we've got a very, very diverse panel of participants, but unfortunately, due to many unexpected twists and turns, our judging panel as well as our MCs have ended up all male and almost monocultural as well. We didn't intend for it this way. We are calling ourselves up, and we will do better next year.
Yes,
Right.
indeed.
All right.
Right. But as always, the CHISEL finalists are judged on their merits as well as the interest from our participating clusters. So this year, CHISEL InnoMatch is also a partner competition of Slingshot, one of Asia's leading global deep tech startup pitching competitions. Slingshot is organized by Enterprise Singapore, and 2025 marks its 9th edition. So congratulations to you. And one of our finalists today stands to win the Slingshot 2025 Top 60 Fast Track Award.
So the winner for this Fast Track Award, really special, chosen based on merit, of course, and will stand to win $50,000 as well as be fast-tracked to the top 60 immediately for the Slingshot 2025 competition. So they're actually going to skip and jump the queue through 2 phases of judging rounds. They'll then pitch their solutions at Switch, which is the Singapore Week of Innovation and Technology 2025. And Switch, of course, is one of Asia's premier innovation festivals that brings together major players from the global innovation scene. That's going to take place from the 29th to the 31st of October this year.
Exactly. And making this happen is, of course, our wonderful Enterprise Singapore team. And we'd like to thank Ms. Thong Sok Yue, Deputy Director of Health and Biomed at Enterprise Singapore, for bringing this wonderful Slingshot opportunity to our CHISEL finalists
Give us a wave,
today.
Ms. Thong. Thank you. All right. Thank you very much. Okay, so let's turn our attention to the core of today's events, our finalists.
That's right.
They're here and they're also online. Each finalist is going to present a 4-minute video pitch. There we have that, 4 minutes, followed by a very, very fierce, brutal 8-minute Q&A session with our panel of judges. Yes.
Have no fear, okay?
Yes.
Because we'll also get our audience to participate. You know, so our dear audience, you're not just here today to watch, but we will also want to hear your voices too. And how you can do that is that you have the power to decide the winner of the audience's favorite award. So vote through these 2 channels. Access the audience's favorite poll tab on your virtual badge that's already on your phone as you register. Or you can scan the QR code on the screen to cast your vote as you hear the finalists' pitches later.
Right, so everyone's got the freedom to vote for more than one finalist.
Yes.
So just show your support for the solutions by voting for those that inspire you the most. And for our online audience, if you can hear us, you may click on the poll on the live stream page itself to submit your vote.
All right. And before we begin the exciting pitches from our finalists, as we're all waiting for them, we also like to share with you the incredible diversity that we've had this year from the participating companies, unlike our judges and MCs. Okay, so our finalists have come from various corners of the globe, spanning across disciplines and types of solutions, such as screening and monitoring systems, rehabilitation solutions, diagnostic technologies, as well as personalized medicine platforms.
So it's really inspiring. I think Casper and I have been fantastically inspired by seeing all this huge global participation. We're looking forward to hearing from all our winners, from their unique perspectives, and all the solutions that they're going to bring forth to Singapore, hopefully. Yeah?
All right, okay, without further ado, let's start off with our first pitch.
Number 1.
Yes, number 1. Number 1 may not always be the worst off, you know. But our first finalist, who is dialing in all the way from Canada, will be introducing RO, an AI-driven screening tool that transforms routine X-rays into early opportunities for osteoporosis detection. So let's welcome 16-Bit and let's get on with their video pitch.
Hello, my name is Dr. Mark Cicero. I'm a radiologist in Canada and the co-founder and co-CEO of 16-Bit. Today, we're excited to share with you our vision for improving osteoporosis screening with RO. DEXA is considered the gold standard for osteoporosis screening. However, less than 25% of the population is being screened today. Luckily, approximately 80% of the unscreened population has had an X-ray for some other purpose. Ro is a software medical device that can utilize routine X-rays performed for other indications in patients 50 and up to screen for possible low bone mineral density. Ro can utilize frontal X-rays of these body parts to generate a score from 1 to 10, which correlates with the risk of having low bone density on DEXA. Users can decide at which threshold they wish to consider a patient Ro positive. Ro has been validated across many different data sets, including ones with Asian, Hispanic, and Black populations. To date, Ro has screened over 400,000 patients as part of their routine clinical care, and we have seen DEXA conversion rates as high as 19% in patients who are Ro positive, demonstrating greater than 90% positive predictive value. And of those patients who go on for DEXA, greater than 50% have been found to be at increased risk of fracture, suggesting that they would likely benefit from therapy. Ro is installed on-premise and can even be run in offline environments with minimal compute requirements and IT burden. Ro does not impact technologists' workflow in any way and can be readily adopted by radiologists with the simple use of macro text within their voice dictation software. Ro has several unique features, making it the obvious choice over the competition. Only 3 other solutions can truly be considered opportunistic, meaning they analyze routinely acquired X-rays without special acquisition protocols. Some competing solutions predict osteoporosis rather than low bone density. And while osteoporotic patients are typically at higher risk of fracture than osteopenic patients, more fractures occur in the osteopenic population due to their higher prevalence. Other opportunistic solutions can only utilize a single X-ray type. In contrast, Ro can utilize X-rays from 6 of the most commonly imaged body parts, allowing it to capture more patients and be used in more clinical settings. Ro can also uniquely allow customers to monitor value generation through tracking of DEXA follow-ups and can even be used to draft DEXA reports automatically, saving physicians time and reducing burnout. Our current go-to-market strategy in Singapore involves selling first to private imaging clinics who offer health screening packages, allowing them to identify at-risk patients who might benefit from DEXA at scale. We are also engaged with radiologists and orthopedic surgeons at TTSH and Sengkang Hospital to conduct further clinical validation and population health and preoperative planning screening initiatives. Finally, we have also received strong interest from Sing Health Polyclinics, who will soon be obtaining a DEXA machine which Ro will intelligently triage referrals for. Ro is priced based off of gross annual X-ray volume. Our pricing ensures a 5 to 6x return on investment for customers who operate under a fee-for-service model, but also ensures net cost savings of $400 per DEXA triggered when operating under a fixed reimbursement model. Sophisticated health economic modeling has suggested that opportunistic screening has a favorable health economic profile in the United States and in Germany, and we anticipate similar findings in Singapore. Adding to the cost-benefit equation is the potential to avoid unnecessary DEXA by utilizing Ro as input to FRAC's risk scores, which we have recently shown has very good agreement with FRACs when utilizing DEXA T-scores. In summary, we believe opportunistic screening with Ro to be a win for all stakeholders, and we'd like to thank you for this wonderful opportunity to improve bone health in Singapore.
And what a wonderful and inspiring start that we have.
Very clever, leveraging on the huge amount of data that's already in the service.
Exactly, and that's where you see the quality of CHISEL companies coming through. Okay, let's bring up Dr. Alexander Bilbili and Dr. Mark Cicero, the co-CEOs and co-founders of 16-Bit on screen. Gentlemen, I hope you're ready for the questions. And to kick us off, we'd like to invite Glenn to pose the first question to the team.
Thanks for your wonderful presentation, Team 16-Bit. I have 3 questions, if you don't mind if I fire them all and you know. So the first question that I had in my mind is that, will this be best done retrospectively for X-rays that are already in the system? I think in Singapore we have the advantage where we probably have quite a massive and rich data source. And if retrospectively is the way to go, how long before, how old can the X-rays be? Or is this better done on the fly? As patients walk through the ED door or comes for clinic SOCs episodes. So that's my first question. My second question is, the diagram shows an on-prem setup. are you ready to do a private cloud-based deployment? And in doing so, then it can allow for more public healthcare institutions to access the same setup versus repeating the setup at every hospital. And the third question that I have is, as you are scaling this solution in Asia, what are your plans in terms of maintenance and support for the Asian markets? Thank you.
Maybe I tackle one or two, and then you can take a couple, Mark.
Sure.
So,
Yeah.
in terms of the retrospective versus prospective, that's a great question. And in fact, we've thought of that a couple of years ago, and we built into Row the ability to analyze retrospective data. The challenge with analyzing retrospective data is the further you go back, the less relevant that might be to the patient's immediate care, because their situation may have changed, they may have passed away, or some other thing may have happened, identified already and whatnot. So although we believe there is actually significant value in going back 1, 2, maybe 3 years as a retrospective analysis and acting on that information, actually all of our customers today that have screened almost 500,000 patients operate prospectively. But we haven't encountered a customer that's motivated to build basically a care pathway that leverages a retrospective data source, but we would be more than happy to sort of support that because we see significant value. As you know, osteoporosis is a chronic disease. It takes many years to manifest, so it makes sense to go back 1, 2, 3 years in that way. I'll answer the private cloud. Sorry, go ahead, Mark.
Yeah, I was just going to take that one. So with respect to private cloud or on-premise, what's important to note is that Row is engineered from the ground up to be scalable to low volumes or high volumes. And so we've used advanced technology to allow for that type of deployment, either in the cloud or on-premise. We like to describe it on-premise is because most customers do like to feel the confidence that knowing that healthcare information stays within their network. And so if that's a public like a private cloud, like the Synapse infrastructure, we'd be more than happy to entertain that. We're very confident that it would scale to either solution.
Mm-hmm.
And I think the last part was just in terms of maintenance and support. We are very committed to establishing our base in Singapore for the ASEAN market as we enter it. We have obviously lots of interest in the Philippines, Vietnam, Thailand, and abroad there. And so, but we do see Singapore as that initial test bed and as that hub. We already have fractional employees who are working with us in Singapore, and we're hoping to grow that team as we scale. Additionally, we as part of our onboarding, we actually train your IT personnel to be able to handle first-line support, and we've really gone that extra step to make sure that our product is easy to use, reliable, and works 99%, almost 100% of the time as much as possible.
All right, thank you, gentlemen. And with the remaining 4 minutes that we have, I think we need to move on to the next judge. So Hyang Kun, over to you for your questions.
Well, thank you for the wonderful presentation. Since Glenn had asked 3, I will just ask you 1 then. I'm glad to hear that you already have partners you're working in Singapore. I'm assuming therefore you know the ecosystem and infrastructure in Singapore. Could you maybe share with us, from your understanding, what would be maybe the 2 or 3 main challenges and hurdles that you will see that may lead to the failure to scale for your solutions?
Yeah, so it's a great question. The first challenge that has often been brought up is this idea of, look, we've developed an algorithm using Canadian population, and we're trying to import that into Singapore, and will that generalize? And we're actually very confident that it will, but obviously needs to be proven out as we scale. Now, we already do have HSA approval. We believe our device is safe and effective, but building that trust with clinicians to know that when they see a report that says this patient has been identified by Row to be at risk for low bone density, we want them to really believe that and to take that next step. And that will come with trust. So I think establishing trust is the first major barrier. I think we're confident we'll be able to establish it. The second one is, of course, one we struggle with a little bit in Canada is
getting from that radiology side, getting that radiology adoption. We look at X-rays day in and day out, and oftentimes there's a little bit of hesitancy when it comes to AI, and so getting those radiologists to believe that the AI can actually see something they can't has been a little bit of a challenge when introducing this technology to Canada and other jurisdictions. So adoption by radiologists and trust by referring physicians, I would say, are the two biggest challenges.
All right, great. Thank you so much to the judges, as well as Alexander and Mark. And we'll say goodbye for now, but we'll see you very soon, shortly, at the end of the session.
Round of applause for our first competitor. Yes, good start indeed.
Yes.
So we're on to number 2 now. Unfortunately, our originally scheduled number 2 presenter, Akurai, they're still landing in an airport somewhere else in the world. They'll join us slightly later. So we're going to swap things around. And let's welcome our first team that will be joining us here in person, and that's Nala Genetics. So moving from radiology now to slightly personalized medicine, they're going to be presenting their AI software that predicts how patients respond to medications, thereby helping doctors reduce side effects and optimize prescriptions. All right, let's roll the video pitch, please.
Hello, my name is Lavana Sani, CEO and co-founder of Nala Genetics. In Singapore, average drug reactions, or ADRs, cost about 8.1% of hospital admissions and cost nearly 5% of total healthcare expenditure, over $160 million annually. Many of these ADRs are preventable, and the science is clear. Pharmacogenomics, or PGX, can reduce ADRs by up to 30% and save up to $7,000 per patient. Yet, adoption has been slow, and that's because there are still barriers across the patient journey. And that's where Nala Genetics comes in. What sets us apart is that we don't just deliver a lab test. We provide a full-stack solution to remove barriers in PGX implementation. First, we provide patient selection tools to identify who benefits the most, which has been selected together with NUH to be deployed within Epic. Second is Geno Assist, an AI-supported chatbot for pre- and post-test counseling in pharmacogenomics, co-developed with pharmacists and highly rated by clinicians. The third is RxMax service via an accredited lab in Singapore with a short turnaround time for up to 300 medications. And finally, an automated update and continuous support that allows for simple and scalable management of genetic information in hospitals at scale. These solutions were developed with experts' feedback, collaborations, and support from teams like Synapse, Precise, and other Singapore ecosystem players and beyond. We first published the burden of adverse drug reactions and have implemented our integrated workflow into a hospital system in Singapore. And based on these publications, it shows that pharmacogenomics testing changes prescriptions in 20% in just screening centers where patients are at risk. And 95% has potential benefit in the future. And among those patients that are tested, there are constant engagement in pharmacogenomics button and information after 1 year of testing. Separate studies have also been found that PGX testing in specialties such as cardiology, oncology, and psychiatry has been proven to be cost-effective. Our solutions have been trusted and used in over 20 labs and locations. Our CDS is being used in clinical workflows with trust generating from our ISO 13485 and 27001 certifications. Precise, Singapore National Precision Medicine Program, has trusted our platform for population-level return of PGX results. And we also have done focus groups with NUS, NUHS, and others to ensure that the gaps we are addressing are useful for clinical workflows. With CHISEL, we aim to scale our pilot towards a more widespread adoption for PGX testing, especially with oncology, dermatology, cardiovascular, and psychiatry patients. We will measure impact by first, the number of prescriptions adjusted based on PGX results, second, the reduction of adverse drug reactions, and third, cost saving through fewer hospitalizations. We aim to pilot first the pre- and post-test chatbot, then the overall testing workflow for about 200 to 400 patients overall to measure its clinical outcomes. Beyond the pilot, we aim to adopt a business model that aligns with our vision and promise of pharmacogenomics testing, and that is to share the cost savings from the pilot to cover for further setup and maintenance fees, and only charge per test. Knowledge Genetics has built the clinical, technical, and regulatory foundation. And with CHISEL support, we can demonstrate at scale how PGX improves patient safety, reduces cost, and accelerates Singapore's journey towards precision medicine. Thank you, and we look forward to partnering with you.
Okay. Now let's welcome her live on stage, Ms. Levana Sani, who's the CEO and co-founder of Knowledge Genetics. Welcome. Round of applause, please. And congrats, Levana, on the early pilots with so many of our hospitals here. Let's hope CHISEL takes this to the next level.
Exactly.
All right, Aymeric, would you like to start off with your questions, please?
Thank you very much, Levana. Could you describe for the audience an actual case in which your app has demonstrated maybe not a $7,000 saving, but a clinical impact?
Yeah, of course. A couple of cases, or the cases that we find the most often, actually happens in cardiology. So cardiology, there's a patient who oftentimes gets a prescription for clopidogrel after stenting surgery. And then the current prescription or current first-line therapy right now is ticagrelor, but clopidogrel is still a commonly used medication that actually has a high genetic association with a gene called CYP2C19. In Asian populations, actually it impacts about 30% of patients. And so if we were to test that patient during the surgery or before the surgery and get the result after the surgery, they can actually tailor the medication for the next 6 months post-surgery. So this blood thinner, choices that they have to take every day to ensure that there's no stent thrombosis or second occurrence of cardiology events in the clinic. The other one is related to statin. Statin is more chronic. This one actually happens a lot in corporate settings. We actually also do corporate settings as well, where they've been taking statins for a long time, but then when the doses gets increased, actually it has association with SLCO1B1, which is a gene that actually predicts muscle breakdown in some patients as well. And so if the patient actually has that genetic condition, then they're actually recommended to change statins instead of increasing dose. And I'll tell you the third one, and then this final one, is actually in psychiatry. So in psychiatry, there's first-line therapy, second-line therapy, and third line. Sometimes people go one after the other, and it takes a long time for them to actually find the first and second, because it takes about 2 months to change therapy, even more months. Figuring out the right medication based on CYP2D6 and CYP2C9, which is often the drugs that commonly address these psychiatry medications, SSRIs, SNRIs, are actually pretty helpful for the psychiatrist to actually tailor the medication and reduce trial and error at the end.
Thank you.
Of course.
Thanks, Aymeric. And Glenn, I know you've got a question for Levana as well. Yes.
Thank you for the wonderful presentation. So, you have done some pilots and deployment in some of the labs in the region. Just wondering what kind of challenges you have faced and encountered. Lab systems is an area of technology systems where tends to be on-prem, tends to be infrastructure heavy, and tend to surface quite a fair number of issues around compliance of policies and cybersecurity and data protection. So what's your experience around that and how do you overcome them?
Yeah, of course. So I guess the integration with the lab systems is really dependent per lab. I think the customization has always been the hardest issue for us, because each lab has their own workflows, and sometimes they also would like to see, for example, integration to our system at the secondary. So in genetics, there's 3 steps of interpretation: primary, secondary, tertiary. Sometimes they only want to do one part, and sometimes the workflows are different. So customization is a key issue. But second of all, actually, it's the scalability of things. I think in administration and different public hospitals that we've worked with, actually to be able to scale, we need to be able to be integrated into the electronic health record as well, not only the LIMS. So what we're doing right now is actually working with Synapse and the team in NUH to actually integrate the results directly into the electronic health record system, EPIC, based on HL7 compliance. But that's still taking time, and that's October 2025 is supposed to be the end date. So I think between those two things, it took us a while to get there, but I think in Singapore, I think we're finally in the right time to be able to scale across the healthcare systems.
Great, thank you very much. We've still got time, 4 minutes more. Any other judges would like to pose a question to Levana? No? All right, then thank you very much, Levana.
Thank you. Thank you, Levana.
Presentation. All right.
All right, and coming up next, moving from trying to reduce ADR, and we are moving on to the next big problem. And we have AI Medical Service, a Tokyo headquartered startup dedicated to eliminating gastrointestinal cancers through AI-powered endoscopy, thereby enhancing early detection. So let's view that pitch video, which will be delivered by Dr. Tomohiro Tada, the founder, chairman, and representative of AI Medical Service.
My name is Tomohiro Tada. I'm an endoscopist and the founder of AI Medical Service. Our company is a global leader specializing in endoscopic AI. Gastrointestinal cancers cause nearly 1/3 of all cancer deaths worldwide. Gastric cancer is especially deadly when diagnosed late. If found early, gastric cancer has a 5-year survival rate of 97%. But early cancers are hard to detect because lesions are flat and can look like inflammation. Our product is a real-time AI tool that helps endoscopists detect early-stage gastric cancer. It's simple to use, with no changes to hospital infrastructure. Just connect one video cable to Olympus or Fujifilm endoscope system. Our product offers real-time double-check during endoscopy. Every time endoscopists take a picture inside of the stomach, AI detects a lesion and displays a confidence score. It works offline with no internet and data link. We have published 20% of all global endoscopic AI research through joint research with 120 top medical centers. Gastro AI was trained on over 220,000 videos from Japanese top institutions, reaching over 92% sensitivity on both images and video. Our endoscopic AI is beneficial not only to patients, but also to endoscopists and medical institutions. Patients get early detection. Doctors gain better accuracy. And increasing the number of cancers detected at an early stage reduces medical costs. Gastro AI's algorithm shows strong sensitivity and accuracy. We are improving false positives, and our latest version, now on sale in Japan, has proven to have sensitivity and specificity that exceeds Japanese endoscopy specialists. In a Singapore study, Gastro AI matched expert doctors and was nearly 3 times better at finding precancerous lesions. We are working with public hospitals in Singapore to build local support and validation. Gastro AI Model G is approved by Singapore HSA, Japan PMDA, Thailand TFDA. More approvals are in progress. We are accelerating growth leveraging Singapore as a strategic launchpad. In addition to gastric cancer, we also have a product for colon and cloud-based endoscopic image reading system approved in Japan. We aim to grow in Singapore over time through expanding early cancer screening efforts with liquid biopsy, training junior doctors with our AI-powered cloud platform, and supporting Singapore's AI efforts. Our team is led by a key opinion leader in gastroenterology and a former vice president of Boston Scientific Japan, backed by 100 full-time employees across many fields. We are redefining the future of endoscopic medicine with AI. We have innovative AI-based real-time endoscopic diagnosis support program, and we have market-ready product with global scalability. Thank you for your attention.
Right, thank you, Tomohiro-san. He's not able to be here with us today, but we have two representatives, Mr. Yasushi Takigawa, President and Representative Director, and Mr. Masayuki Tokano, Singapore and Southeast Asia Management Representative from AI Medical Service. Welcome.
Thanks.
So, Chewy, you have the ground to start the first question for the team.
Thank you, Casper. Hi, good morning, Mr. Tokano and Mr. Tokigawa. I was actually quite intrigued by your technology solution itself, where there is like an offline model. The video, for example, showed that with one cable you can plug into Fujifilm or Olympus with no data management requirements. I was hoping to invite you to share a little bit more on the strengths and limitations of such a system design. And do you see certain limitations, for example, in terms of offline learning, remote update? Like, yeah, please share your views on that.
First of all, thank you for inviting us to these sessions. And as for the question, obviously, as he mentioned, the limitation is we do have some endoscope. But in the future, probably the Olympus, Fujifilm, or others, probably our system can be adaptable for any endoscope. And for the data strategy itself, the currently using for some outside sources. However, as we mentioned here, we do have the external cloud system already developed, and which can be installed in the institution, or maybe the just cloud. Through the securities, probably we can secure all those things and sharing with a worldwide basis. That's what we're thinking right now.
Thank you so much.
All right, okay. Imran, over to you for the next question, please.
Good morning. Thank you for your presentation. I'm just curious, how does your AI algorithm differentiate between inflammation and early gastric cancer? And what is your false positive rate, and how are you reducing it?
First of all, thank you for the question. Probably it might be difficult to understand for the many people outside of medical. The first, colon cancer and the upper GI cancer is completely different. And maybe colon cancer, you may see a lot of the assistance, but detecting the polyp. But then other cancer is maybe for the flat lesion. It's very difficult to identify at the even though the normal situation. So we are challenging for the hardest part first, comparing for the other competitors. And as we say, we have a series of column coming in here, and maybe the esophageal or maybe the duodenal. That's everything is on the pipelines. So at the end of the day, one system can measuring for the upper and lower through the one endoscope. That's our system is.
What is your false positive rate now?
Pardon me?
False positive.
Right now, it depends on, maybe we are aiming over 95 to 97. And for the false negative rate, it could be still high because of data is not enough. Although we are probably the biggest database have in the world, as we say, over 200,000 images carried out through the pathology data. That is the key point. But once we have more data coming, that's why we are here in Singapore to collecting the more data for, especially for the upper GIs and then also pre-cancer region site. We call it for the GIM. That is the most popular here in Singapore, and we're gonna bring for the not the Japanese version, but for the global version from here to the global site. And that's why we start working with several, because like your the institutions right now.
Okay. I guess this is a third question. Do you think that your technology can be applied to other mucosal cancers like bladder and nasopharyngeal cancer?
Depends on the image. And as far as we can correct for the image or data, yes, we can. So that's why I say we are right now trying to go in for the throat. Sometimes, if you're going for the upper GIs, many doctors missing for the throat cancers, just going for the esophageal and going for the stomach. But our system probably can adding more function. And then also we are, trying to think about going for the other area. Other area meaning is not for the lumen side, but for the the non-lumen side like skin or other cancers. The AI is not perfect, but what we need is a data, and we are having a lot of data comparing for the other companies, and we can commercialize it.
So that means that your AI is differentiating between inflammation and cancer, early cancer.
Yes, we can. The early, the so-called precancer region and cancer is different, and we can differentiate it. And if you are going to the patient or the patient comes in and having for the the precancer regions, we found it, and maybe giving for the caution, say you're gonna come back next year and check it out. And as far as you have a same patient image, we can compare year by year and how the progress is. As you understand, the cancer is not dying immediately if you find out earlier. So doctor is a decision maker, not the AI. But then AI can fully support doctor decision. And that's why we need the AI supporting for the physician in terms of the endoscopy world.
Thank you.
All right, thank you so much. And I think that's all the time that we have.
Sorry,
thank
Casper.
you, Takigawa-san and
Casper,
Takano-san.
could I
Thank you very much.
Oh, sorry.
Sorry.
Casey.
Just a quick question. If you deploy this AI, have you compared the performance between the an experienced endoscopist versus an inexperienced endoscopist, whether that gives you the same performance?
Actually, yes. And inexperienced doctors has honestly some of the paper already describe it, but an expert is close to the at the AI level, but the non-expert is far below the AI level. And one more thing you understand it, even though the expert, if he doing for the endoscopy early in the morning and late in the evening, the rate, success rate is different because of the fatigue. And the endoscope is standing for 8 hours and working for it, and they are getting tired and missing the polyp or missing the region. So that's why AI can support as a second eye for the patient, for the physician.
All right, and thank you, judges, and also thank you, AI Medical Service representatives, for
Thank you very
joining us
much.
on stage.
Thank you. Right, very interesting comment at the end about human fatigue playing a factor as well. Okay, we've done Canada, Singapore, Japan, and now we move on to Estonia. So that's our fourth company we're meeting today, and that's Better Medicine. So they've developed an automatic AI model that helps radiologists detect kidney lesions and therefore speeding up the diagnosis of renal malignancies. Let's listen to their video pitch.
Hi there, I'm Dr. Chris McKee, Managing Director at Better Medicine, and I'm delighted to present to you our final pitch for CHISEL. Globally, there is a cancer problem, but sadly many cancers are often diagnosed either incidentally or simply too late. And earlier detection of cancer means a higher chance of survival and something we should always strive for. Sadly, though, there is a critical gap in cancer care that is made worse by the surging demand for imaging services, which far outpaces the current supply capacity. In Southeast Asia alone, it's predicted by 2050, just over 2 million new cases of cancer are anticipated annually. And this will be exacerbated by the fact that Singapore has fewer radiologists than that of Europe already. This is where AI can help us. Current approaches to utilize AI are typically focused on lung, breast, and prostate applications, which is fine, but less common cancers such as those within the abdomen, kidney, liver, and pancreas are remaining underserved in terms of AI. This is where Better Medicine comes in. We have built the world's first and only CE-certified clinically validated AI model for kidney lesion detection, the first of many in our portfolio. This provides automated measurements, inclusive of volume, and automatically indicates lesions that are malignant and benign in nature and characterizes them for you. A clinical validation study with 6 radiologists in a blind study on 200 cases revealed high levels of sensitivity, over 99% when using our AI supporting radiologists, and improved inter-reader agreement. We actually found that BM Vision Kidney reduced interpretation workflow by up to 52% in the kidney cancer diagnostic workflow. This, of course, creates a great impact for the patient, as early detection of these incidentals means we can find them in earlier stages and improve survival outcomes. For radiologists, this acts as a second pair of eyes, giving every radiologist the tools to confidently flag kidney lesions, enable faster reporting, and reduce their backlog and improve efficiencies. And of course, the healthcare systems benefit from this as a whole, because finding cancers sooner means fewer hospital stays, reduced need for repeat scans, and reduced cost of interventions for earlier stage disease. Our solution is ready for deployment. It's CE certified, and we have the appropriate ISO accreditations, including quality management system. This will accelerate our route to approval in Singapore via HSA and HPA. We have a simple but effective deployment plan. We wish to validate our model on local market data and fine-tune our AI where required, utilizing cases from local scanners and local population data. Clinical deployment will come next in a single hospital to show proof of value of our incidental finding use case in the market, and we have ambitions to scale wider in Singapore and the further Southeast Asian markets where appropriate as well. In parallel, we will wish to translate our health economics model into Singaporean relevant data. Operationally, we also offer seamless integration and data security. We can integrate either directly via PACS and RIS, aligned to EHR systems such as Epic, with on-premises deployment also being an option. Existing platforms such as Carpool, already in use in Singapore, are available to us also. We have the ability to be hosted on AWS or Azure clouds in Singapore as well to make this a relatively seamless process. Our health economic assessment carried out in Estonia showed a cost-effective outcome when utilizing our solutions. We improved the amount of QALYs gained per patient and an incremental cost of just over €8,500 per patient. Efficiency was also shown where interpretation time was reduced by 33%. Overall, this provides a cost-effective solution, which is scalable with sustainable pricing, aligned with Singapore's healthcare financing framework. We offer a per-scan AI fee, which integrates seamlessly into existing imaging charges, aligned with how hospitals already bill for their scans. This is compatible with Singapore's finance mixed approach. The cost could be covered via subsidies, Medisave, or out-of-pocket payments for the patients directly. Hospitals can absorb this cost and expect a return on investment through the efficiency gains and reduced advanced stage treatment expenses for those cancers found in earlier stages, and a greater volume of use means a lower price point for us as well. Thank you for spending the time to listen to this talk today. Terima kasih, and we're delighted to see what comes next. Goodbye.
Right, thank you very much. That was Dr. Christopher McKee. And let's bring him back on screen with Mr. Prit Saluma, who is the founder and CEO of Better Medicine. So, gentlemen, yes, we can see and hear both of you. Good, thank you very much. So, Casey, we'll start off with you for the questions for Better Medicine.
Very good morning. Can I just check with you regarding the health assessment, the economics assessment that you did in Estonia? Was that applied to CT scans that were done in patients suspected to have renal malignancy, or were they all really just incidental CT scans? CT scans done for other reasons.
CT scans done for other reasons.
So was that done as a background screening all CT scans opportunistically, or how was that applied? Because
we function as opportunistic screening solution. So we are looking for incidental findings, providing a safety net for doctors and also patients.
Can I also understand whether this?
When the health Sorry. So just to clarify, when the health economic assessment was carried out, it was basically carried out for, as Preet says, for the incidental finding use case. So it was carried out on a multitude of CT data.
So in other words, it was just a tool that's applied across all CT scans in a way, in the background, and then you were trying to pick up incidental renal malignancies. Is that the correct application?
Yes, that is correct.
Second question I can ask is whether there is a plan to expand this technology or your AI tool to other solid organ tumors for the abdomen and pelvis.
Absolutely. We have already proof of concepts for pancreatic cancer and liver cancer. We also have a medically tested already a solution for lung cancer as well.
Thank you.
Okay. Glenn, yet another AI algorithm to onboard onto our systems. Any questions for Better Medicine?
Thanks, gentlemen, for your interesting presentation. Singapore is quite a vanguard adopter of image AI. The radiologist fraternity in Singapore, I would say, they are very forward-thinking and very forward-leaning. We have actually done quite a fair bit. One challenge that we have had with CT scans thus far, because of the massive number of layers, it becomes richer, it becomes bigger, the inference take longer, and that adds extra complexities to the turnaround time and matters like that. So does your AI require all the layers? Or do you actually only need specific layers? And if you only need specific layers, how then do you integrate with the modalities to such that you only extract the layers that is relevant to your AI algorithm?
Currently, we're working with the whole CT scan, so we use all the layers. In the future, we can look into the optimizations when necessary. So far, we have seen no problems in inferencing time.
Glenn, happy with that answer? You all right?
Could I just ask another question regarding the specificity and the sensitivity? How does this tool compare? Because for the radiologists, they're already quite confident about diagnosing renal malignancies when it is indicated.
So on the patient level, we have 96% sensitivity, and when combined together with radiologists, we achieve 99.2% sensitivity. Specificity number I don't have right now in my head, but it's also something.
Yes, and just to add to this as well, that because this tool is intended to be used as an incidental finding safety net tool, the radiological professionals who will benefit from this will also be those that are not necessarily looking or primed to look at the kidney. So in those instances, this is the issue with kidney cancer, that if you're not looking for it, you miss it. So we have high levels of specificity, high levels of accuracy that Preet has just mentioned, and this will actually help those non-specialist radiological professionals to red flag these kidney lesions, which are very often missed, which is a global problem. This is something that we've seen across the world in terms of not being able to find these incidental lesions. And then, of course, we can help those trained professionals in terms of the characterization process and improve those efficiency gains as well.
Good, thank you. All right, we've got a bit of time. Any other questions from any of the judges? Okay, if not, then thanks very much to Preet and Christopher. Do stay online. We'll see you later. Thank you.
All right, thank you. And we have actually zoomed through 4 pitches, and we are going to come in for the 5th pitch, and it will be the last pitch before we head off for a short break thereafter. So let's hear it from Jens Technologies, also from Singapore. Jens aims to make preventive screening and chronic disease monitoring more accessible with Mediscan, a portable health screening device for safe, non-invasive screening of lung, liver, and kidney health. Let's look at their video pitch.
Hi, my name is Justin. I'm the founding CEO of Jens Technologies. We offer an AI portable health screening device, which does 2 things. We do preventive screening, and we also do chronic disease management. Primarily, we operate in liver, so fatty liver, and we also have capabilities in lungs and kidney. So on the top left side, you can see the EIT device, which is our main technology. It's connected to 2 things, to the belt, which we wear around the torso with a 1-minute test. And then on the right, it's basically an app where it's on Google Store, App Store. And we do the test and also the reports there, basically also in real time within a minute. And a bit about our backgrounds. We're invested by Alibaba, Gobi Partners, also some universities and private venture capital in the Asia region. We also partner with over 10 professors in Hong Kong, in US, and elsewhere. We've completed clinical trials with them, we've published with them, and then we have been improving our algorithms with them as well. So we've won the Forbes list. We've also won the Jumpstarter Award regionally. So fatty liver, it's a big prevalent disease in Singapore. We're talking about over 1.8 million people who are going to projected to have it by 2030. It's important because it doubles the healthcare cost between people who has fatty liver and people who don't. So if we tackle this properly, we can potentially save $640 million annually. And it's partially because it's a leading cause of liver cancer, HCC, and liver fibrosis as well. The good thing about fatty liver, it's really reversible. So compared to later stages, we want to tackle it in the early stage. That's why we're looking at this. Operationally, it's quite simple. So on the left-hand side, you have a nurse or anyone, doesn't have to be medical background. It could be a social worker, it could be a volunteer, putting on the belt. Takes 30 seconds. On the middle side, you run the test. So around 1 minute. Fat liver is 39 seconds in our system. And then basically it generates a report out in real time. So other than numbers that you can easily interpret, we also report some talking about general guidance on how do you manage fat liver with lifestyle changes, dietary changes, and other things. So it's really easy for laymen to even interpret it and talk about this. So we run this through corporate screenings. We do community services, home visits, quite a lot of things that's been commercially deployed. So the technology is called EIT, electrical impedance tomography. Basically, what we look at is electrical properties of different tissues. So, for example, fatty liver tissue and healthy liver tissue has very different properties across electrical frequencies. So we sweep those, and then we recognize the region and generate a score out, which is very easy to interpret. So overall, we have done over 400 people in clinical trials, 6,000 people and more on commercial deployment side. In Singapore, we can operate in polyclinics for fatty liver screening and management. It's quite helpful because in screening, there is a 50 to 80% increased compliance rates for any advice that in lifestyle, any changes that people are instructed to do. So it's quite effective that way. And obviously, if we need to do revalidation of all the clinical trials in Singapore, we are happy to work with the system as well. So in Hong Kong and Asia, we've worked with public system to reduce patient flow back into the hospital. We have worked with private sector as well to do lead generation, to do health management. We also work with elderly sectors for home visits, community visits, and general health advices. So patents, we have 9 of those. We have also published quite a lot in Nature Scientific and other places. With the professor's name on it. Commercial compliance with 13485, 60601 for electrical safety and system management. We also have 6304, which is software. And then we've also completed due diligence with big corporates as well. So thank you very much.
All right, thank you, Justin. And it's very interesting to see, indeed, let's give him a round of applause. It's very interesting to see, how we can also have solutions that will benefit the community as well. So Justin, just to invite you up on stage. And the first question will, the judges will ask you the questions. Yes. And the first question will be from Hyang Kun.
Hi, thank you very much. Maybe a couple of questions. One is, what is your presence in Singapore? And secondly, most of the data that you have garnered, which population has that been based on? You anticipating that you are going to see different demographics here in Singapore, and how applicable would that be?
Right. So I'll answer the second question first. We have mostly done clinical trials in Hong Kong, so Chinese, Asian types. But we've also done a validation study in US with a sort of intended partnership with one of the US universities as well. So actually in the US, the sensitivity specificity is even better than what we have done in Hong Kong. So if we have to do some adoption in here, it should be.
And why is that so?
It's not really massive. It's like 1% difference. So it's within the margin of error. So yes, and sorry, and the first question would be in...
Your presence in Singapore.
Right, so we're pretty much just starting. We have some presence in the region, like in India, Indonesia, mainly on the primary care side as well. But in Singapore, we're very much hoping to use this as an opportunity to go into polyclinics and other avenues as well.
Could you outline to us, and it's not apparently clear to me in your presentation, how are you operationalizing the scaling? Who are the partners? How do you intend to, what is your business model like? What is your charging model like?
Right, so the business model, it's quite simple. We have a simple device that it's a fraction of what ultrasound cost. And then at the scan, we have each report generating as well. Generally, the end customer price is around 20% of what ultrasound would cost. And that's because partially who we require to operate, it's really simple. It doesn't really have to be a nurse or trained sonographer or anything. And in terms of the operational model, we work at primary care mainly on any places that have as a room, some privacy, that could integrate into that service as well. So in private sector, we work with lead generation. So they go on to do corporate screenings, home screening, corporate sort of community visits. So inside the centers, elderly care. We work quite a lot on targeted patients, sometimes with diabetic patients, sometimes with a certain age range. So we do it in the centers as well. Sometimes it's a health day. They go in 30 people in the morning. Sometimes they combine it with more visits. So it could be visiting certain sites or even homes as well. So public hospitals, sometimes we build up local capacity with them. So they have satellite clinics, they have satellite partnerships with different local operators. So we use that as an ongoing engagement tool. So every 3 months you come in for a scan. And then we do see people, even as the screening itself, it's a really good intervention tool. So once they know they have certain conditions, we see a huge improvement just because they're aware of this. Yeah, sorry.
Just one follow-up question. So if I hear it correctly, it's both, you are using this both as diagnostic, but as well as a follow-up tool.
So technically we're doing screening. So with diagnostic will require a doctor. We help them to have a lot more longitudinal data and a lot more simply because we can scale a lot more as well with the cost, with the operational personnel.
So pretty much a screening tool rather than a follow-up tool, right?
Correct.
Got it.
All right. Thank you, Hyung-kun. Cherry, over to you for your questions, please.
I was going to just build on Hyung-kun's question as well, because I have a similar set of questions around intended user segments as well as patient segments. Apart from what you have shared, Justin, are there other use cases in the community that perhaps you feel you want to share with this panel?
So other than the elderly services, the home cares, the clinics, health days, corporate services, we also have some longer-term follow-ups. So part of that system, instead of just having the EIT score, we integrate with other tools that can be done in primary care as well. And overall, we generate sort of a more holistic portfolio that people can refer to a bit more regularly as well. And because it's not just working inside a hospital system, sometimes we do operate a lot with external partners that can combine a lot more data that hospital do not actively gather. And it's quite useful because if we have quarterly health updates that are organ-specific, it helps sometimes the diagnosticians to follow up with that patient on trends and other things as well.
Do you see that your business model might change over time as you spread and scale in the community?
Absolutely. We have different business models in different regions. Some of the regions really like leasing models. Some of those are really specific on OpEx. So we lean into heavily on per scan. And some we have to combine different services inside as well. So with follow-ups with other things. So it's definitely really country specific.
Thank you. And do you have any specific models that maybe you would recommend for us to think about a little bit more, especially as we think about community health in Singapore?
Right. So it's something that I think as a start, we could start with diabetic patient screening. It's one of the highest risks. So we're talking about 2 to 4 times higher sort of progression with those the population, and the incidence rate is quite high as well. So among diabetic patients, we have around 70% of those that we would expect to deliver. And we have looked at those as well. If we look at diabetic patients, tell them they have those sort of things, it does improve sort of compliance rate of health advice to 50 to 80%. So that could be a really good start just to look at things.
Could I just ask one more question? Yes. Yeah. It's an evolving business use case. Are there any plans to move this from screening to follow-up tools? And if you're doing so, what are the challenges that you may face?
So from screening to follow-up tools, meaning doing multiple, yeah. So we've already been doing that. So normally when we do screening, a lot of them would schedule a post-scan as well. So typically around 3 months' time. So that's when we really see people has that validation of, okay, my health actually improved. What I'm doing with diet, with exercises are helping my health. And we see compliance after the post-scan being really engaging as well. So this is certainly a tool that we're growing into.
All right. And thank you to the judges, and thank you, Justin, as well. Thanks.
Right, so the first 5 finalists are out the gate. Can we give them all a big round of applause? Thanks for sharing your solutions with us. All right, we've heard already from 5 fantastic finalists, 5 down, 5 to go.
That's right.
So let's jump in now and meet finalist number 6. Sorry, ladies and gentlemen, let's settle down and turn our attention to our finalists. And they are called Gyro Gear. They're from Singapore, and they've developed a mechanical gyroscope-based medical device that provides self-adapting hand stabilization for those with essential tremors and Parkinson's. Let's take a look at Gyro Gear's video pitch, please.
All right.
Hi everyone, I'm Dr. Fai Ong. Gyro Gear has developed the only gyroscope-based solution for shaky hands. We seek to give 200 million people globally a new lease of life. The Gyro Glove bridges the significant gap between medication and brain surgery. Patients and doctors confirm the lack of alternatives. The Gyro Glove is an assistive device designed for individuals with hand tremors to wear on demand. This is due to a mechanical flywheel that instantly and proportionately cancels out these hand tremors. Here, we have a customer trying the Gyro Glove for the very first time. She has had severe hand tremors for over 30 years. Even patients with severe hand tremors can wear the glove by themselves.
I can feel it trying to take over my hand.
Yeah.
But that's
great. That's a lot better.
That's so much improved.
Users too are reporting significant secondary benefits. Here, a gentleman frozen stiff with Parkinson's tries the glove for the very first time in the middle of Kansas. He is able to box, stand on one leg, and move fluidly once more, surprising even his boxing coach. And this is what our global community, and by extension, the data potentially collected looks like. Given the impact, Gyro Gear is working to pioneer full-stack services for 200 million people, given the incredible lifelong pain point and the lack of competitors. Looking ahead, we are developing the world's first integrated care and tremor management system for users, caregivers, and clinicians. Hand tremors are highly variable from patient to patient and are very dynamic, changing rapidly from moment to moment due to activity, emotion, and even fatigue. Our early-stage models have thus been trained on real-life activities. The data collected has no identifiers and cannot be traced back to the end user. The Gyro Glove is the core of this treatment platform. Critically, we aim to build a self-sustaining flywheel based on hardware, software, and services. The platform provides disease tracking and autonomous integration with medication and long-term care. We have hardware and control system support from Foxconn as our shareholder and strategic partner. With Singapore's aging population far outpacing conventional care supply, we ask for your help to run a multi-center study and to connect us with the following programs. 29 global neurological centers have independently approached to partner us in the last year. In the future, our technology can be applied to other parts of the body, given that tremors affect all limbs, the head, and even vocal cords. With our combined effort, we seek to build future integrated hard and soft systems for other neurological conditions for Singapore and the world. We have 3 commercial pipelines: America, China, and online sales. In the US, we have successfully registered in all relevant Veterans Association sales platforms with a distributor and sales team now in place. In China, we have a distribution network with further support from Foxconn. Given the demand online, the glove is presently out of stock. Going forward, we seek to build a gradual ramp-up in revenues from both hardware and software sources. Yet, without an education and upbringing in Singapore, all this would never have had happened. Singapore is home to us. We have committed to an operational hub here and would like to center digital health development on this island. We truly hope this will mean lifelong service to our fellow Singaporeans. Thank you.
Fantastic. Wow, a great start to our second half and wonderful videos as well, before and after videos. So please welcome onto stage Dr. Ong Jun Fai, who spoke at the video, and also Mr. John Piatkowski, who's the head of commercialization of Gyro Gear. Gentlemen, come on board, please.
All right, good morning. Thank you very much.
Thank you.
Thank
Speaks
you.
personally to me because my partner's mother is suffering from Parkinson's, and I'm sure she'd love to box me once in a while. So
We can
the
help with
person
that.
stake
We can help
this.
with that.
Don't ask why. Don't ask why.
All right, thank you so much.
Let's start off with Kirk. Questions for Jaragir?
Good morning, sir.
Good morning. My mother has Parkinson's too, but she's never tried to box me. So, but yeah. So since she has Parkinson's, it was something that I was really interested in. But this was not something that the neurologist brought up to her as a possibility, right? So my first question is this due to a lack of clinical evidence? I can see that a lot of patients and patient testimonial, but so what are your plans to build up more clinical evidence so it can be made more available through the clinical pathway? Number two, I said, I have to get this for my mom, but I looked at the price, like, wow, 6,000, so while it's sold out, I'm sure a lot of those who need it, many of them cannot afford this. So what are your plans in terms of financial sustainability and making this more accessible to people from lower resource countries?
I think you're absolutely correct, Kirk. So thank you very much for that. So I think on to the first question. So in terms of clinical evidence, we have a network of, so the glove is actually designed mainly for the American market. We founded the company in London. We have an operational base in Singapore, developing, shipping, and also managing the entire flow around the world for this product. So currently, this version of my hand is actually tailored towards the sort of Western sort of markets, hence the sort of bigger battery pack, et cetera, et cetera. So now what we're trying to do here is that because we set up, the entire operational sort of base here, we know that we can produce reliably and we can actually tailor the device now for the Asian sort of community, make it lighter, make it smaller, again, adapt it to the needs of the local populace. So that's why we are looking and trying to test bed this here right now. And in terms of clinical evidence, we already have early stage discussions, for example, with SIT, I believe Prof. Look is there, NUHS, and of course, A-STAR. So again, we'd like to build that local base of evidence and start introducing, with all of your help, into the local healthcare system. Does that answer your first question, sir?
So what you're saying is that with local production and all that, there's a possibility to produce at a lower cost and price it at a lower price.
Correct. And I think most importantly, you always have to focus on the stakeholders and the customers, and you go from there basically. So the entire backend has been built to adapt to support that.
And you're already working with local practitioners to try to build a stronger evidence base, especially for Singapore population.
Correct. And again, we could always use more help, so we kindly ask for that sort of support if that's possible today.
Yeah. So my next question is, beyond just tremor reduction, what other impact have you seen with the use of this?
All right. So our device is currently a mechanical damper for hand tremors, right? But we're also reporting very interesting sort of what we think to be stimulatory effects. We see these sort of potentially breakthrough secondary effects, especially in Parkinson's. So I'll give you an example. In Parkinson's, we have a constellation of symptoms, everything from dyskinesias to bradykinesia to basically issues with mobility, control, etc. We're seeing that when individuals put the glove on, we're seeing them completely, these symptoms completely resolve. And we're seeing individuals with severe, for example, a gentleman with bilateral deep brain stimulation, a stroke, and this guy was in Pittsburgh. He came to CES with us. He was able to stand up. His speech issues also resolved. He was able to turn, walk, and leave his cane behind. And he also forgot about his wife at CES, and then he just went around the entire, huge exhibition hall because he could just walk again, you see. And so these are interesting elements. And the most interesting symptom we've seen, again, still uncharacterized by us, individuals with Parkinson-related insomnia. We've had several cases where, including this gentleman I just described, where they put the glove on and they're able to have the first full night's worth of sleep in years, basically. So again, we're looking to investigate that, and I'm sure the integrated sort of support and resources in Singapore will help us take this to the next stage.
Thank you, Kirk. All right, and Aymeric, over to you, please.
Yep. Thank you.
Yep.
Thank you for this presentation.
Thank you, sir.
I think what you described with the last patient that you described was it's a phenomenon called Bristol-Sika syndrome, where patients who have, for example, severe spasticity and an aphasic type of symptomatology. If you reduce the spasticity, they can speak better. So there
Thank
may
you
be
so
a
much.
medical basis for that.
Wonderful. Thank you so much.
Going on the medical part, right?
Yes.
So you have 6,000 gloves made.
No, not 6,000 gloves.
How many gloves have you made?
So we've made only a couple of hundred at the moment. We only just started commercialization.
And you have a lot of anecdotal evidence. You have a lot of anecdotal evidence.
Yes, we do.
But so I'm just curious, I mean, there are many dexterity scores out there, right?
Yes.
One of the simplest is DASH. There are many dexterity scores.
Correct.
Where's your data?
All right. So in terms of the data, right, we use mainly Tetris as a tremor sort of a benchmark. We haven't yet actually looked at DASH as yet for the dexterity tests. So in terms of Tetris, we're seeing about a 70 to 80%, sort of reduction in terms of the tremor scores, basically. And that is only based on internal studies. We do acknowledge that we are yet to run formal clinical trials.
So why not? I mean, I would say that would be sort of the baseline for your work.
Correct. You're absolutely right, sir. And the reason is that because it's been relentless in terms of getting funding, getting the sort of operational backbone, getting the entire production, all your regulatory sort of clearances done in the last 1.5 years. And then now we're just about generating the funds to actually help us get the clinical trials done. So now we're at that stage already.
You're at trial stage?
Yes, we have the initial contracts lined up, mainly overseas, but we have yet to execute. That's also in the immediate pipeline.
I mean, I would suggest, just like for the boxing guy, right? A quick dash, then you do a dash after he puts the glove on.
Correct. Absolutely correct.
So how does it work? How does it damp?
All right. So in terms of the actual mechanics, right, what you have is a spinning flywheel in there. So that is a mechanical gyroscope. So what it does is that it immediately and proportionately counteracts the tremor. So whether it's a very mild tremor or very severe tremor, what it should do is basically damp out that shake. And also, again, what we suspect is happening is there is a stimulatory sort of mechanism because it's spinning at about, let's say, 16,000 RPM.
Okay, just one technical question. Yeah. So it damps out the shake at the wrist joint level?
Yes. So distally there.
And would it be possible to make this sort of mechanism, it looks like a very good exoskeleton, would it be able to provide motor power at any point in time, say in 5 years' time or 10 years' time?
So to answer the question specifically, what we've done basically is assemble, hopefully, the sort of industry's best sort of pipeline, specifically clinical partners. We have all the universities in the West, like MIT, Harvard, Imperial, that are backing that. And then we connect that with the operational sort of backend by the world's largest manufacturer, in electronics, which is Foxconn. So again, that's a combination. And I hope with the values and integrity that we can find here in Singapore, then that pipeline should allow us to push any product that you could physically conceive.
Thank you.
So please, we hope to be able to work with everyone here. Thank you very much.
Thank you very much.
Thank you so much.
And John, thank you. Okay, bring it back there.
Sorry,
no worries. Okay. Answering very tough questions from the judges for more data, but less cost as well.
Exactly.
Okay, great. Let's move on, Casper.
And let's turn our focus back to Japan, and we have Livescapes. So Livescapes offer a solution that utilizes AI-driven brainwave analysis to activate compensatory neural pathways, providing a non-invasive treatment for patients with severe motor impairments. So let's have a watch of their video pitch.
Hello, we are Livescapes, developing BCI medical devices based on 15 years of research. After stroke, many patients are left with hand paralysis. When the hand becomes clenched and cannot open, it makes daily tasks like dressing, eating, and working impossible, drastically reducing quality of life and personal dignity. However, current methods are not effective for treating hand paralysis, especially in severe cases. Severe hand paralysis impacts about 30% of the 10,000 stroke cases each year in Singapore, leading to $500 million in economic losses annually. To overcome this problem, we developed a neuromodulation device using BCI technology. Using a wearable EEG device, the brain signals are read out. The AI analyzing the brain waves and drives the robot when it detects that the remaining neural circuits are activated. The robot supports finger movement and gives feedback to the brain. Through this framework, BCI facilitates the reorganization of the brain, enabling the paralyzed hand to move again, even without a device. The following results are from clinical studies with chronic severe patients who were thought to have no further recovery potential. After 2 weeks of training, muscle responses were observed, and the patient could grip and release objects. Since launching the medical device in Japan last year, we have already treated over 900 patients. As shown in the video on the right, he is now able to write and eat using his previously paralyzed hands, leading to a significant improvement in his daily life. This outcome reduces the burden of family caregivers, leading to economic benefits both for the individuals and the healthcare system. When we look at the real-world data, we can see treatment effects in 3 clear stages: changes in the brain activity, improvement in muscle response, and enhancements in finger movement with meaningful daily life recovery. These results show not only the effectiveness, but also how easily it can be put into practice in clinical settings. Our core technology is a certified high-quality EEG measurement system powered by a pre-trained model that runs locally, minimizing security risks. By leveraging AI-driven noise reduction, our solution enables fast, non-invasive brainwave acquisition while ensuring cleaner and more reliable data. Regarding intellectual property rights, we hold fundamental patents in BCI therapeutic efficacy, including EEG measurement and analysis, which secure our technological edge and clinical applicability. Currently, 2 BCI devices have already been launched as medical devices. While competing products require a 12 weeks training period, our device achieves better results in just 2 to 4 weeks. Furthermore, our device offers ease of use with setup time more than twice as fast as competing products, can be mastered by users in just 2 hours. This user-friendly design is a significant advantage in busy clinical settings, making our solution highly appealing to healthcare professionals. We provide community-based services that combine solutions for hospitals and nursing facilities with those for home use. First, we sell devices to hospitals and subscription-based software and maintenance. Second, we plan to direct-to-consumer services for home use, taking into account local suitability in Singapore. In Japan, we've sold over 50 units in less than a year. We have identified significant impact that helps patients improve their daily lives. With our visual technology, we envision a future where paralysis no longer limits potential. Together, let's make this vision a reality and transform millions of lives. Thank you.
Thank you, Livescapes. And joining us here in person, we have Mr. Masaaki Hayashi, who is the Chief Strategy Officer, and also joining us virtually, we have Mr. Ryotaro Hirose, Head of International Business at Livescapes. Well, judges, Casey, you have the first question.
Thanks very much for this presentation. Can I just ask, is the same, you compared with your other 2 competitors, the solutions, is the same sort of improvement observed with the other competitors versus what you are coming up with? Can I just ask that?
Thank you for your question. Comparing in those competing product PCI, we hold high accuracy, high precision EEG measurement system and high accuracy feedback system to induce the neuroplasticity more strongly. We check examine the rate of accuracy, which is higher than those competing products.
And if I may ask, the cost difference between the 3 solutions, how does that compare?
It's cheaper than competing products.
And can I just also ask, is this only for the hands and the fingers? Because in a stroke patient, we also know that beyond the paralysis of the hands and the fingers, there is the entire upper limb girdle that will be affected. So how does that affect the whole functioning of the patient? Or is this just very specific to hands and fingers and therefore, I would say, a limited use case?
Yes. Our BCI has not only finger function, but also other proximal muscle or leg, the gait ability. Our clinical data showed significant effect in those whole body parts. In addition, our core technology can be applied if the electrode location can be different place. We can capture any those activities. So it can be applied whole body parts, not only the finger function.
And in terms of the, how do you charge for the use of this device? Does it mean that every patient needs to purchase one? Or is this going to be something that, that the hospitals can use for multiple patients?
Yes, our system adjusts individual patient depending on any difficulty of the training. Regardless of the severity, even patient who has a severe disability, we can apply them in those patients who has no previously improved with conventional technologies. In moderate or mild case, of course, it can be used.
Okay, thank you.
All right, thank you, Casey. Kirk, over to you.
Hi, thank you for being here. Your setup looks very sophisticated, but it also looks quite complex. So my question is, how easy is this system to set up? What resources are needed? What kind of manpower and what kind of training, right, is required for a session to take place?
Thank you for your question. Setup time is quite easy to compare the other robotic or BCR devices. For example, we have experienced in Japan more than 140 hospitals. They are adapted with under onboarding process. We provide 1 or 2 hours in-person practice session and 1 or 2 follow-up session. In such a 3 hours, therapist can learn how to use it, how to operate it correctly without any issues.
How long does each session typically take, and how many sessions would be needed to see some kind of meaningful functional improvement?
We require 40 minutes per day and continue with across more than 10 days. In just 2 to 4 weeks, severe patient can recover from severe to moderate on mild level.
Okay. Just go back to the first question. So for each session, what kind of resources in terms of trained manpower needs to be present? Is this something that you need a trained nurse or technician to be around, or is something can also be supported by a caregiver?
For the preparation, therapist should taking care of the wearing the device to the patient, but after that, patient can use it by their own.
I see. Last question from me is a follow-up on the cost. How much does it cost to set up one system, right? And in terms of ongoing cost, is it just manpower or there are also disposables?
It costs about $60,000, and one device can be used about more than 10 patients per day and has a lifetime of 5 to 10 years. So it may necessary to consider design a model where patient contribute to appropriate fee that matches the value they receive.
Could I just chime in to just clarify? Did you say the disposable are $60,000?
Yeah.
What constitute the disposable?
Yes.
What are the disposables?
In terms of ongoing cost, the main factor is manpower and having a therapist to run the session. And we need extras for 4 extras for one session.
Electrodes, I see. Hyun-kun, did we get the answer? So it was about the disposables and the consumables per session.
It's less than $300.
Mm-hmm. 300 are the electrodes, and that's per use.
Less than $3 per use.
$3 per use.
$3 per use.
Right? $3.
Yes. Right. It was $3. Can we clarify? It's $3 per use, sir? Is that right?
Yes.
Okay. Right.
I just have a quick question because in the slide it says your usability is 5 minutes, but you mentioned that each session is 40 minutes. So what does that refer to, the 5 versus the 40?
Yeah, preparation time 3 minutes are included in the 40 training session.
40 is for 20 sessions. Is that right? That was the total amount of time
Over 20 sessions.
for 20 sessions.
Over 10 to 20 sessions.
10 to 20
Right.
Sorry, so it's 40 minutes per session or over 20 sessions?
Right.
Over 20 sessions, I think.
20.
Yes.
Yes.
So per session,
40
it works
minutes
out. Yeah.
per each session.
Each
Oh,
session.
each session.
Each session.
40 minutes each session.
Okay. All right.
Fine.
Thank you.
Okay.
No worries. All right. Thank you very much.
Thank you, judges, and thank
all
you, Masa-san. Thanks, Ryutao-san.
Okay. 7 down, 3 to go, and moving now from neuro-rehabilitative solutions to cardiology. So let's welcome Akurai from Sweden, who are now presenting a non-invasive, AI-powered cardiac pressure monitor, which aims to enable early and accurate heart failure management. Let's see the video.
Hi, my name is Philip Peters, and I am the co-founder and CEO of Akurai, where we are personalizing heart failure therapy with non-invasive cardiac and pulmonary pressure sensing. There is a large unmet need for a heart failure monitoring solution that can aid in the detection and personalization of heart failure therapy and improve care in the community setting. The Singaporean healthcare system suffers from high readmission rates, difficulty in diagnosis, and long length of stay. Cardiac and pulmonary pressure evaluation is the single most impactful way to improve outcomes in heart failure patients. Yet current reliable methods for pressure evaluation are both invasive and resource intensive. Akurai's FDA breakthrough device designated hardware enables non-invasive cardiac and pulmonary pressure sensing for improved community-based and transitional care of heart failure patients by estimating the right atrial and pulmonary capillary wedge pressures. The device is standalone, easy to use and implement in patient workflows with no patient health record system integration required and minimal training needed for the user. You simply place the patient in supine position, enter patient information, and then record data for about 3 minutes from the patient's chest, and then a device presents both the pulmonary capillary wedge pressure and right atrial pressure in terms of traffic lights, and then also hemodynamic congestion index, which allows you to track the patient's condition over time. The device is based on the SAVE sensor system, which is a patented multimodal sensor platform powered by machine learning, which has been trained on large global proprietary datasets. Akurai is the only system in the world leveraging a combination of these 4 sensors, and we have built what are now the world's largest clinical datasets to validate the machine learning models in the device. We have been able to demonstrate high accuracy, and this has been validated in over 2,000 patients in 20 leading hospitals across 6 countries. Subgroup analysis demonstrate robustness across gender, BMI, and ethnicity. And we've been able to do this with some of the world's leading hospitals within the cardiovascular and heart failure space. Akurai believes that it can substantially help improve early detection of heart failure in the Singaporean healthcare system, reduce fewer A&E attendances, improve transitional care, and enable more care to be done in the community. This starts in the A&E, where we believe that we can help offer faster and more accurate triaging of patients with suspected heart failure, to the polyclinic, where we believe that we can offer improved treatment optimization and transitional care, help avoid avoidable readmissions, and then, of course, go into the community care setting and offer both remote and hospital at home care, which allows us to intervene earlier and offer preventive care. Akurai's competitive advantage is built on high accuracy and scalability compared to both existing solutions and solutions in development. We're an easy-to-use device and integrate with minimal training required. We have superior accuracy, and we're the only device offering both right-sided and left-sided pressures. And we're a multi-patient use device, which offers some very attractive health economics for our healthcare users. We are substantially meeting the stakeholder requirements of the ecosystem from patients, physicians, providers, payers, and policymakers. We're targeting a 7 to 10 Singaporean dollar pay per test business model, which we believe has the potential to offer a 20x return on investment for the healthcare system as a whole. We're a technical co-founding team who've worked together for many years, and we're a global team of 20 who are making this happen. We're a very agile team, and we have the ability to adapt products quickly and adapt to clinical study requirements quickly. We've been able to work with some of the world's leading heart failure specialists and medtech executives who have helped us take this device from inception to where it's at today. Thank you for your time, and I look forward to answering any questions.
Thank you. A round of applause for Akurai, please. And let's bring Mr. Philip Peters himself, the CEO and co-founder of Akurai, on screen.
Hello, Philip.
Glad you could join us, and you've
Good
landed
morning.
safely.
Hi.
Where in the world are you now?
I've landed safely in Minneapolis.
Minneapolis. Okay. Hello from Singapore. All right, Kirk, could we start off with the first question from you for Philip?
Thank you for the really interesting presentation. I noticed from your slides that the large-scale clinical studies, the results of which you're going to be sharing in a conference today, right? September, it's 26 to 28. Could you maybe, give us a bit of insight on what are the key findings from the study? Does it validate what you have in a smaller study, and do the science point towards you with this study getting full FDA approval in 2026?
Yeah, so the data is looking good. We're very happy with the data. What that means for us is that we are able to demonstrate a high level of accuracy versus the clinical gold standard, so the right heart catheterization. We have high sensitivity and high negative predicted value, which allows us to effectively rule out hemodynamic congestion, which is one of the major ways of that we believe that our device will be used. We also had an FDA QSub meeting just last week, actually, which was very positive as well. So we have a clear pathway to get FDA clearance towards the end of next year. With that said, things with the FDA tend to change both for the better and for the worse these days. So I'm always reluctant to put a specific date on approval, but next year is the target for the company, yes.
My second question is that even with this large clinical trials, it has been done mostly with patients in the US, Canada, I understand, maybe even the EU. What are your plans to validate the technology, in more diverse ethnic populations, including in Asia?
Yeah, so it has been done predominantly in the US and in Europe, but we have had a large South Asian population in our UK sites. We've had a large East Asian population in our Canadian and West Coast sites. And of course, a large African American and Latino population as well. So roughly 40% was non-white population in our phase 2 prospective cohort. With that said, we are actively planning for studies. So we have an investor in Taiwan, or 2 investors in Taiwan, including 1 hospital. So we are looking to kick off clinical studies in Taiwan early next year as well.
Thanks, Kirk. Over to you, Casey.
Thanks. I've got a few questions. I understand that the accuracy is good, the specificity is good, but the sensitivity is good, but the specificity is actually quite, it's in the low side. So you're going to end up with a lot of false positives. Has the cost of, dealing with the false positives been considered in your health economic assessment?
Yeah, I think it's always a trade-off, right? In heart failure, the cost of a false negative is a lot higher than a false positive, right? I think that's the approach that we're taking. A false positive in our case will simply mean that the patient goes down the same triaging and diagnostic pathway that they would go down anyway. So we don't think it will cause much extra resource burden on the healthcare system.
A second question I have is because if we are going to have to validate the studies, the product in the Asian population, what do you think will be the key challenge in trying to do this validation?
So I think workflow is always the challenge with particularly heart failure, which tends to be managed very differently in different countries. I mean, even in Europe, each country has its own way of managing heart failure. And I think for us, it's about designing health economic studies that make sense for more than just one country at a time, right? And ensuring that we are able to perhaps define a workflow, a new way of managing heart failure patients that is able to be applied to many different healthcare systems. And that's really the goal of Acri and helping to transform the way that we treat these patients.
I think for the local population, the challenge would be having to subject the control, population to a right heart catheterization, which is already what we're trying to avoid here. So I think that's probably one of the issues. Can I have one last question? Is in terms of integration with the EMR system, for us, we are using Epic. Is that going to be a challenge for Acri?
No, so we're integrating with Epic in the US, right? So that's something that is in our pathway and timeline. With that said, we can send data wherever we need to send it, but we're not reliant on a two-way communication with any system. So it's a fully integrated device with the model on the device. So it should work just as well in rural countries as opposed to urban countries, right?
Great, thank you. We still have 2 minutes more. Any more questions from the judges? No?
Yeah, I have one. So if we were to do this as I understand that the algorithm is on the device, which is of course a strength. But how would we be able to learn post-adoption data or from the data post-adoption to improve the system if it is not aggregated?
Yeah, so we have I could take the US example, right? We have a pre-specified design control plan for our machine learning algorithms. So we will collect, real world data and post-approval data, which can allow us to do discrete updates to the model. In terms of, sending the data initially, I think we're seeing this as more of the way you would use a blood pressure cuff. It will become a new vital sign that you do every time a heart failure patient comes in or a suspected heart failure comes in. And then that data will be sent to wherever you need to send it, or you will just write it down, just like you would a blood pressure measurement today.
You okay with that, Yang-Yun? Okay with that, Yang-Kun? Okay, saved by the bell. All right, Philip, thank you very much. Please stay online. We'll see you later. All right.
Yes.
Good.
And coming back to the same time zone, we're leaving the US for a while. We have NDR Medical Technology, a Singaporean company, was developed an AI CT image analysis for lung tumor detection. Let's have a look at their video.
Hi, I am Alan Goh, CEO and founder of NDR Medical. Today I'm going to introduce our AI tumor detection and visualization software. Lung cancer in Singapore, almost 8,000 people are diagnosed from 2016 to 2020. 4 in 5 will have death within 5 years. That's almost 3 deaths per day, and 50% of them have never smoked in their life before. Globally, it's a major problem because 2.4 million people are diagnosed annually. The golden standard for treatment is surgical removal or resection, but the risk of surgery increases with age and recurrence of cancer increases with stage. Stage 1 recurrence is up to 19% and stage 2 recurrence up to 27% and more. The patient consultation process generally requires a chest X-ray or a chest CT to be taken, and most of the patients during the life and death decision making whether to treat their cancer are generally concerned because of the lack of information and confidence, and typically they prefer more opinion for confirmation of their disease state. Generally, they will seek second opinion. That's up to 88% of them, and 42% of the time, you end up with a change in treatment plan or the delay in treatment altogether. The delaying of treatment increases the rate of cancer recurrence, as we have seen earlier. Nodule double in size every 180 days, and the loss of procedural income for hospitals they visited. and the risk of malpractice claims as shown in the diagram below. Hence, there's a need for better visualization tools during the consultation process to empower patients to take charge of their cancer treatment plan. Hence, we introduced our ND analyzer that provides 3D segmentation as well as AI nodule detection. We can visualize the loops of the lung, the visuals, the bone, the vessels in a very clear manner in 3D, the airway as well. You can view the diagram in axial, coronal, and even in the sagittal plane. It allows for preoperative planning of how the surgery is being performed either by resection or by ablation. When you show the patient a three-dimensional diagram of where the cancer nodule might be, it empowers them to take charge of their treatment plan. More than just a patient consultation tool, the software itself allows us to assist in planning for biopsy or even treatment by ablation or even for resection in the future as well. The business model is very simple. Our software can be subscribed on a yearly basis for $20,000. We are targeting hospital with at least 500 patients. There's an average cost about $40 per patient. If we target a 10 million population which is screened for cancer in total, there's a total addressable market of 400 million. If we just target the top 3 countries suffering from lung cancer, there's about 1.3 million with a 20% market penetration rate. There's a serviceable optimal market of 10.4 million annually. We will first target a private hospital because the affluent patient generally prefer a second opinion, and this is how hospitals provide a premium service differentiation. Next, we will go to the university hospital with key opinion leader endorsement. Finally, going into the public hospitals and ASC for mass market adoption. Beyond just the software, it can be integrated together with a robotic system as shown in the photos. We have done lung biopsy in Singapore as well as in Japan. Beyond just a lung, it can be adopted into liver and many other anatomy as well. We have validated the AI together with Stanford and other hospitals in Japan as well as in Malaysia. More than a good investment, we save life by treating cancer early. Join me in setting the new medical standards in software and robotics.
Thank you, NDR. Let's give them a round of applause. And joining us on stage, we have Mr. Alan Goh, who is the CEO of NDR. Come, Alan.
Welcome.
Just right in the middle of the stage, please. Thank you. Just in the middle. Yes, thank you. Hyang Kun, you have the floor for the first question.
Hi, thank you for the presentation. As the Singapore health system, I believe the aim is towards a harmonized common platform. And how are your system, which is specifically designed for one organ and one disease type, how is it designed to reduce fragmentation of what we're hoping to do in terms of the whole imaging technology and how we integrate in the current system that we have?
In actual fact, when we design the whole system, it doesn't deviate away from the current workflow. So patient generally will still take a CT image, and the CT image is used to generate the three-dimensional diagram that I've seen above here. When we first started the whole design, it was meant for interventional radiologists to plan treatment of biopsy or ablation. For now, we are actually pushing it forward to serve the clinicians or the surgeons during the consultation portion. Because if the surgeons doesn't refer the patient, the interventional radiologist doesn't get to treat the patient with the software or the robotic system. So it's pretty much already integrated in the system.
Could you, so these are already a defined patient group, the diagnosis is made, this is really assisting in the treatment planning. And as I hear it, it allows you to do interventions such as biopsy and also on designing maybe the field of radiation. Is that I'm getting this right, correct?
Yes, that's the original intention.
Yeah.
It's just that we realized that with the first CT scan, because generally if you take an X-ray, that's something that I think other AI solutions are working on. But if you are taking the first diagnostic CT or even a low-dose CT, it can be loaded into our software and we can generate the three-dimensional diagram. The AI can identify the nodule. So it can be used slightly earlier in the screening or the diagnostic. And of course, implemented at the further downstream is the treatment, how treatment is being administered using ablation and resection.
And in terms of operationalizing this, how do you interface with the current workflow? Are you saying that the clinicians can do this on site as the CT scan come on in real time? It would be able to click a button, see this on the image. Do you need to send it for pre-processing before it come back? And how long does it take to generate these images?
To answer that question, it can work on both ways. The design was for real-time solutions. So the whole robotic system, just now you see in the photo, is implemented in SGH. So we plug into the PAC system. Every time they take a CT scan, the DICOM images are loaded into our software, and we generate we reconstruct segmentation as well as the AI detection. It takes about three plus minutes, including the data transfer portion. And for that, the surgeons can choose the nodule. After they chose the nodule, in actual fact, trajectory pathway are being planned immediately for them. They select the most optimum pathway that is being advised. Then there will be a robotic device that comes in to assist in the access. So going to the other question that you were asking, so we don't require pre-op images to be taken. It's all in situ or real-time solution. Hence, if you are using a pre-op images, you can be doing it offline, meaning for pre-consultation for the surgeons to use. It doesn't have to be exactly real-time.
Maybe just one last question. Sure. What would you articulate is the most compelling competitive advantage with what you have versus your competitors?
In actual fact, I would guess is the treatment. As you can hear, most of the diagnostic solutions in the market, it provides you so-called an assessment, like whether there are going to be cancer, the sensitivity, the specificity. But what we went ahead is after diagnosis, after sort of the AI software detects a tumor, potential tumor, what is the next step? Whether do you perform a resection or you do an ablation, or even if you perform an ablation, what is the best route for the ablation to be performed, or even biopsy? Hence, we are utilizing AI for the treatment plan. And that will have a significant difference because if you visit different consultants or different hospitals, you realize that sometimes the diagnosis or even the treatment options are varied quite differently.
All right, thank you, Hyang Kun. Glenn, over to you. Yet another AI platform for you to question.
I have 3 questions, and they all center around your productization strategy.
Sure.
You have decided to productize all in one box. Everything is within one box. Why did you go down that path? Why not a thin client-based application that can then be more scalable, accessible by multiple users from multiple departments, understanding that the radiology, in fact, radiology in radiology department and radiology in ED, they are at different places, right? So that's my first question. Second question is also related. If everything is in that one box, do you send your inferred images back into the PACS? If you don't, then how do we ensure that clinicians from different departments and different locations can collaborate for the patient's diagnosis and prognosis? Second question. The third question is that you have done integration with PACS with one hospital. I think this is not a question. This is really just extra information from you. We have had a lot of challenges integrating with PACS across all the hospitals. The PACS are very different. Even if it's on the same product, same version, they are very different. So be mindful that the interfaces and the integration will require some robust testing as you move along. So coming back to my first 2 questions, please. Thanks.
Okay. Can I start off with the last question? I think thanks a lot to Snapsys, because initially when we tried to implement it in SGH, is quite a challenge. And it was very helpful assistance to integrate together with the current PAC system. So whatever you have seen there, we actually done it in Japan. We also done it in Netherlands. So we have integrated the system together in a couple of sites, not just Singapore alone. Having also to answer that first question, it was first designed as a AI robotic guidance, hence it's in a box solution. Does it have the potential for onboarding on the cloud-based system? Yes, definitely it is possible. It's just that right now when we design it, it's a box-built solution. And for commercialization plan, rather than scaling as per mass adoption, we are looking at more of slightly premium services. In terms of the cost structure, if you look at it, if patient were to look for a second opinion, they probably will have to pay a lot more in terms of consultation fee and time taken.
All right, good. All right, thank you. We're quite short of time, so perhaps I think we'll have to close this segment as well. Thank you, Alan.
Thank you.
Thank you. All right, we're down to our last finalist, and we've really gone around the world. We started off the morning in Canada. We're going to end in Canada again. And this company is called Acoustics. And guess what? It's another AI solution, this time focused on liver disease. So Acoustics uses AI to analyze sound signals on ultrasound devices, enabling point-of-care diagnosis and monitoring of hepatic disease. Let's view this last video pitch for the day.
I'm Beth Rogozinski, CEO of Acoustics. Today, over 2 billion people globally are living with liver disease, and many more are at risk. The epidemic rise in liver disease is being driven by the obesity and the diabetes epidemics, which are causing a rise in metabolic-associated fatty liver disease, or MASLD. MASLD is the most common chronic liver disease today, and according to Raffles Health, the fastest growing cause of liver disease in Singapore. Liver fat and fibrosis are expected to drive most liver-related cancers, mortalities, and transplants in the next decade. And the liver diagnostics market is expected to exceed $60 billion by 2030. Current approaches to catch and diagnose liver disease early are complex and time-consuming, with several appointments and specialists involved. It's expensive and often involves high-end imaging, or it involves highly invasive biopsy. But there is a better way. Our first product, the Onyx, is a fast, low-cost liver surveillance solution that makes the complex, expensive, and invasive process of diagnosing structural liver disease seamless, painless, and done in 5 minutes. Acoustics is a software-only solution that leverages existing ultrasound systems with a very unique approach. We mine the sound in ultrasound, enable ultrasound to go beyond what can be seen by the human eye. If you look at these ultrasound images here, it's really difficult, even for an expert radiologist, to differentiate between these two scans. But by applying our patented machine learning algorithms, we can map the tissue acoustic properties and provide quantitative insight into liver health. With locked presets and guidance on our app, Acoustics removes the variability of both ultrasound acquisition as well as its interpretation, making this a valuable point-of-care tool. The impact that this has on health systems is profound. For clinicians and their patient, this exam and results are simpler to order and complete than a blood test, and the immediate results can be provided to the patient all within a single visit. The Onyx integrates seamlessly into any clinical workflow, and the exam can be performed by any care team member, so that when the doctor sees the patient, she's fully armed with results and can immediately get the patient into treatment. The net of all this is a significant stage shift in when troublesome liver disease is detected, so that lower cost and more effective treatments can become earlier. This is also better and cheaper triage, which sends fewer patients into expensive and invasive diagnostic cycles. The Onyx has been validated against a clinical standard for liver fibrosis, the FibroScan, but the device doesn't need to be connected to a PAC system or even an EMR. The solution comes fully equipped with everything it needs to get started with minimal effort and training. The data is fully encrypted end-to-end and transferred via secure cloud server. Our solution is intended for frontline clinicians, but our vision extends to reaching primary care clinicians so that at-risk people can get screened at their regular checkups. With the robust values that we provide and by riding on new low-cost ultrasound systems, we're poised to launch a successful SaaS-based business model. With low-cost systems, we can deploy an end-to-end solution for under $5,000 and charge a per-scan fee that gets reimbursed. Beyond our first product, we have additional products in the liver that are already in development. And our vision extends to building a virtual biopsy platform that covers every anatomical area of the body that an ultrasound can image. We'd be delighted to have Singapore be a foundational site for our efforts into Asia and to work with you as we tackle the $60 billion liver diagnostics market and build a billion-dollar business.
Thank you. That's a great presentation to round off all our finalists. And let's call back onto the screen Ms. Beth Rogozinski, who's the CEO of Acoustics. Beth, can you see and hear us?
I can. Thank you so much, and thank you for including Acoustics in this wonderful roundup.
Our pleasure. Okay, at question time. Choi, your questions for Beth? Yep.
Oh, thank you, Hon Tim. Hi, good morning, Ms. Rogozinski. I wanted to maybe invite you to quantify the differential costs, because I think you have mentioned in your video the proposition that your solution is low cost, but would you be able to quantify that a little bit further?
Yes, absolutely. Thank you for that question. So our initial device, and this is a platform, I should say, but our initial device can be deployed on an end-to-end system. And as I mentioned in the video, we don't make the hardware. So instead, we actually leverage and can distribute a kit that looks quite like this. So, we can distribute this kit at a get started cost of about 5,000 US. And by comparison, our comparator in our FDA studies is a FibroScan device, which costs over 300,000 US. So that's really the comparison, right? A big capital expenditure for a hospital like a FibroScan or shear wave elastography ultrasound system versus, we can deploy an end-to-end device for about 5K.
So 5K versus 300K.
Yes.
And how do you think some of these savings would be able to trickle down to providers and patients?
As I mentioned in the presentation, we're really expecting that this is going to be able to enable a stage shift in when liver disease is diagnosed. Today, fatty liver disease, as my earlier colleague was saying in his presentation, is really very common, but it's really critical. And we can measure not only liver fat, but liver fibrosis as well, which is the most dangerous aspect of morphological liver disease. And we can actually, estimate the risk and the risk profile, right? It's not a binary exam. We can actually categorize according to the Medivir fibrosis scale or the steatosis scale. So, giving additional insights. So really, we anticipate that we'll be able to, just do better triage for patients across the board and diagnose more disease more rapidly.
Thank you.
Thank you, Choi. And Casey, you've got the last questions for the day.
Yeah, thanks very much for the presentation. I looked at your comparison between the different modalities for fatty liver, and it is indicated that ultrasound, in comparison, is a fair method for diagnosing fatty liver with steatosis. But today, the gold standard, or rather what we use, is FibroScan. So why is it that you are able to say that Acoustics is much more superior to the standard of care?
So our first regulatory submission is that we're substantially equivalent to the FibroScan. And so by comparison, as I was saying earlier, we're better, faster, and cheaper. And the reason that obviously we're cheaper at $5,000 versus the cost of a FibroScan. But why and how we're better is that what we do is the sound waves actually send back, we can do a micro tissue analysis via those sound waves. Right, so the FibroScan actually just does a pure physics measurement and can only really even get the two measures of fibrosis and steatosis. As our our approach, our technological approach is this microtissue analysis. We'll be able to go beyond this, and we've already got a number of patients in a data set that we're developing to do a binary diagnosis for liver inflammation and a pure diagnostic for MASH, right? Which today can only be diagnosed via biopsy or MR. So, via our microtissue platform analysis, we can actually go well beyond the labels of the FibroScan, but our first submission and what we're looking to deploy today is substantially equivalent to that device.
Can I also understand when you validated, or rather you tried out this algorithm, what type of population was it done on? Was it in a diverse population, including an Asian population?
Yeah, a very diverse population. We had very busy liver centers in Beijing and Shanghai. We're currently working in Hong Kong. We've got some centers that we're talking to, the Veterans Hospital in Taipei. And then, as some of my colleagues noted, in city centers in San Francisco and Toronto, very diverse populations. So it really covers a wide range of ethnicities and backgrounds of the patients that we're able to diagnose.
Thank you.
Thanks, Casey. Any final questions from the judges? We still have a couple of minutes to go. All right, if not, that brings us to the end. Thank you very much, Beth.
Sorry.
I have one.
I'm sorry, did I miss?
Hi, Beth, thanks
Sorry,
for
sorry,
the
Young.
presentation. Just, it's not apparently clear to me. So, you don't sell the hardware. The integration of your algorithm, how does it interface with, say, the hospital EMR system? Just use example, Epic.
Yeah, so we don't need to integrate with a hospital EMR system. We present a resultant score. We don't need to integrate into a PACS. We've actually done some work where we're using, third-party APIs. Really, what we're really intending to do is to, leverage what we consider exponential technology, right? There are these APIs that can integrate into the EMR, but ours is really intended to be a standalone system for ambulatory care patients that can literally be carried in your pocket, right? So this doesn't need to integrate into EMR. We've got some tools from Health Gorilla and some of the other API developers that we can work with if we want to automate in that way. I think you all know, as you're trying to get to one version of Epic, that even Epic actually has multiple different instances, right? And so we've been really spending our time and focus on our technology and developing these tools for this kind of point of care. And then we can do, NRE workarounds to integrate into any type of EMR that is required.
And sorry, just one last question then. Therefore, you're saying that there's a real-time analysis of the data coming from the ultrasound, and it doesn't need to be uploaded anywhere for further analysis, right?
No, we do currently upload the data to the cloud, right? So our machine learning both guides the data acquisition, and so that's actually automated on the device, that quality metric. So any care team worker knows when they have enough liver data, and then they can move on and submit the exam. Then within minutes, the results come back. This is encrypted end-to-end, HIPAA, GDPR security standards. And we have begun work on what we call an edge deployment for hospitals that don't want to go outside of the cloud. But we're actually cloud agnostic. We work on GCP, AWS, Azure, and we can work on within any system.
Great. Thank you very much, Beth. Another interesting dilemma, standalone versus integrated. Thank you so much. And a round of applause for our last finalist.
And ladies and gentlemen, here you have it, the 10 finalists for CHISEL InnoMatch 2025. And let's give them all a round of applause again. Thank you. And we now moved on to the most difficult segment, but it's not for us, it's for the judges. And they will be actually taking leave from the halls to another room for their deliberations and to choose the 6 winners. So judges, may I invite you to leave the halls and to also just follow Pi Kwang for the deliberations as well.
Do take your leave. We'll be locking you in.
We'll be providing lunch as well.
Undisclosed location.
Yes.
All right. All right, I think, Casper, we've witnessed fantastic creativity and innovation this whole morning, but really what matters just as much as what the audience thinks. So we're keen to see where the audience favorite award standings are at the moment. Can we call that up? Wow.
All right, okay, we
Fantastic.
do have some results there, but these are not final. Okay, you can continue to vote for your audience's favorite award right through to after lunch. So even as you go for your lunch and you go out there and speak to the finalists at their booths, please, continue to put in your votes so that we can actually have a better sense of where your favorites are.
Fantastic, Junfai. So you've had tough questions from the judges, but it looks like the audience is giving you their warm support.
Yes, exactly.
Okay, ladies and gentlemen, we mentioned at the beginning of today that CHISEL InnoMatch is a partner competition for Slingshot 2025. And so now's a great time to find out a lot more about this global competition. And let's welcome Ms. Esther Bui, the development partner for ecosystem and community at Enterprise Singapore, to share more. Esther, can we bring you on stage, please?
You'll be there. Esther, the stage is yours.
Please welcome Ms. Esther Bui.
Hi everyone, I'm Esther from Enterprise Singapore, and I'm part of the Department of Startup Ecosystem and Community. Yeah, so great thank you to Center of Healthcare Innovation for having Slingshot as a partner competition, and happy to share a little bit more about Slingshot as well as Switch with everyone here today. So Slingshot, this year we are now 9th edition, and we are a global startup pitching competition for global startups, and we seek to anchor high potential startups into Singapore. And through this competition, we also hope that our investors as well as corporates would be able to access startups that have high potential. Yeah, so running for our 9th edition, we have actually received over 6,800 participations this year, bringing our total number of applicants to over 36,000, and we have received applications from over 160 markets, and of our winners post-competition, around 50 of them have gone on to raise about 500 million in USD investments, and as of today, we have over 500 international judges and mentors here with us. So Slingshot is part of Switch. Switch is the Singapore Week of Innovation and Technology, Asia's leading deep tech festival, which I'll share a little bit more later. So just wanted to share a little bit our Hall of Fame for our past 3 years of winners. We have MedWorks, which was last year's winner. They specialize in thermophorus materials. And Thermalytical, our 2023 grand winner, they are a clean tech startup, and Peptobiotics, our 2022 agri-food and tech startup winner. So for Slingshot, we look at 4 competition domains from emerging technologies, and these are where we source our solutions from. So firstly, we do have the manufacturing, trade and connectivity domain, the health and biomedical domain, the environment, energy and green technologies domain, as well as the transformative digital technologies domain. So from these 4 domains, our startups will apply, and then from there, we would pick our winners. Our qualifying criteria for application would be that we are looking for international startups with a minimum viable product that meets the following criteria. Firstly, whether the startups can illustrate initial signs of traction. Secondly, whether they have proprietary technology. And thirdly, also whether they have been registered for less than 10 years within their country of registration, and fourth, that they are not a subsidiary of a corporate entity. And last but not least, a big part of our work at Slingshot is that we want to anchor high potential global startups into Singapore, and our startups will have to indicate intention of setting up their shop in Singapore. So part of our Slingshot program features our immersion program, which is a highlight of this program before our domain finals, where we would fly in our top 60 global startups into Singapore. So at this moment, we are actually contacting our top 60 domain finalists to fly them to Singapore in time for this immersion program, which will be held from the 24th to the 27th of October. So during this 3-day immersion program, we would be introducing them to the local startup ecosystem, providing them with one-to-one pitch coaching and mentorship opportunities. But last but not least, we will also be allowing them opportunity to network with local investors, corporates, as well as ecosystem partners. Yeah, so just a little bit of timeline that I believe CHISEL has shared here and there. So in terms of our road to Slingshot 2025, actually, from March to July, we had our global call for applications, and then we closed it end July, and then we had 2 phases of judging, which were very rigorous, and our applications, were vetted at least 6 times by the judges before our top 60 startups were identified. And now we are in a phase of calling them down to make sure that they book their flight tickets and make their arrangements to come to Singapore before the immersion program in Singapore on the 24th to the 27th of October. And finally, we have our finals, which will be held from the 29th to 31st of October, held at Switch. So happy to announce this year that we have actually doubled our top 3 prizes for our grand prizes. So our grand winner was then to walk away with 400K in Startup SG grant, and our first runner will be winning 300K, and our second runner-up will be winning 200K in Startup SG grant. Yeah, so allow me to share a little bit more about Switch as well. So Slingshot Finals will be happening Switch this year. So mark your calendars from 29th to 31st of October. Yeah, Switch, as I just now previously did an intro, is a leading deep tech startup festival that connects global Asia's innovation ecosystem through premier thought leadership, vibrant networking, as well as partner events, as well as Slingshot Finals. So this year is particularly special for both Singapore and Switch. So as Singapore celebrates its 60th year, Switch also celebrates its 10th edition, our anniversary. And as such, actually, Switch is one of the few enterprise events that has been marked by the SG60 calendar. Yeah, so Switch is also growing this year. Year on year, we have received quite a lot of growth. So last year we had 20K in unique attendees, and 1 in 5 of them were international attendees. And we have seen participants from over 100 markets. We have also hosted about 125 content sessions, 350 plus speakers, as well as have 400 plus exhibitors exhibitioning with us on our trade floor. Yeah, so as we grow our show, we're also mindful to keep more than half of our attendees C-suite reps, and we are also looking at a bulk of them being startups and investors. So a little bit of snapshot of who joined us last year, as we are still gathering our elite speakers for this year. We had Mr. Heng Swee Kiat, former DPM, who is also the NRF chairman. And then we had Dr. Eric Tun, the CTO of Breakthrough Energy, Mr. Elias Khan, the former vice chair of Quantinuum, Mr. Paul Santos from Wavemaker Partners, and Mr. Vishahano from 500 Global. And last but not least, we have our local unicorn hero, Mr. Craig Siri as well. Yeah, so a little overview of Switch 2025. Since we run over the 29th to the 31st of October, we will also be having 3 stages: the main plenary stage, the Switch Global stage, as well as the main stage, the Slingshot stage. Yeah, so across the 3 days, there would be content sessions, beyond panel sessions, as well as our trade floor. That would be where our exhibitors will be exhibitioning, as well as our networking zone. Yeah. And on the 3rd day, we'll also be having a community open day where we'll be bringing our innovation partners and communities from Singapore together at Switch. For Beyond this year, Beyond is our paid thought leadership content that features deep tech content with an Asia perspective. Yeah, so roughly on day 1 and 2 and 3, this would be our snapshot of our broad topics. And the write-ups for each of these panels would be listed on our website. So as part of engaging the wider community with Switch and SG60, we'll also be holding our lab crawls, which will be happening on 28th of October, which is day 0 before our main program, where it's free to sign up. You can tour our launch pads, our IHLs, our incubators, as well as any other participating corporates. And then we also have our community open house on day 3, which seeks to engage our youths in science and tech. And we also be looking to host a youth hackathon. Yeah, so that'll be all for Switch. And if you're interested, you can sign up for a free pass by scanning this QR code here. And as part of our SG60 promo, we actually have 60% off our Beyond Stage pass, which will be happening from now all the way until 30th of September. So be sure not to miss this promo out. It's quite a SG60 special. Yeah. So, sorry.
Oh, no,
Last thing. Promise, I'll keep it short. So last but not least, I just wanted to plug Stage 1 by Startup SG. So this is a joint platform by the Enterprise Singapore as well as the Economic Development Board. So this is a one-stop platform for all global startups who seek to incorporate into Singapore. If you are looking for anyone to talk to, if you are looking to be connected with any ecosystem partners, and if you are looking for investors and whatever not, actually Stage 1 is this receptacle where all global startups can seek to contact. And I will just leave Stage 1's contact here. You can reach Ding Zhi as well as Ying Shi. Yeah, that will be all. I'm finally done. Thank you.
All right, thank you very much,
Thank you
Esther.
so much, Esther.
Right.
Yes, as you have all heard, thanks for the free access to the conference. And for the finalists, one of you will be walking away with this award. And it's not only the $50,000 that you can look forward to, but also potentially one of the top 3 prizes that's been listed there as well. All right, ladies and gentlemen, I think you're all very hungry now after hearing 10 pitches. So we are getting ready for lunch. Okay, for those who are joining us online, please do come back by 12:45 p.m. And likewise, for the audience here on site with us as well, even as we release you for lunch, please do come back here also by 12:45 p.m.
And don't just eat, there's an exhibition, lots of booths from this year's finalists, from past year's winners, as well as all of CHISEL's partners as well. So please connect, explore, and eat at the same time. All right, we'll see you at 12:45. Thank you, everyone.
Right, bon appetit.
All right.
Okay, welcome back everyone, and so sorry for the delay. I tell you, if you were in the room, you have felt the tension of the deliberation and the difficulty in choosing between all these great finalists and their solutions.
We have to qualify though that it was a very civilized discussion. There'll be no injuries. The judges are all alive and unscathed.
Right, okay. And now it's time for us to get back to the main event. Okay, what we're going to do now is we're going to go into a 15-second pitching that each of the companies will be giving to us, both physically here as well as online. So,
okay, so let's welcome again all 10 finalists, but on stage, let's bring on AI Medical Service Asia, Gens Technologies, Gyro Gear, Livescapes, Nala Genetics, and NDR Medical Technology.
Right,
Yes.
in that order. And
Right.
if you could just stand in a bit of a curve so that we can see everyone. Yep.
AI Medical Services, Gens, that's right. Just hold up that's right. Livescapes is 4th. We need Gyro Gear here, number 3.
Yes.
Gyro Gear here, great. Hi. And then Livescapes, Nala Genetics, and then NDR, right? Okay, great.
Right. And the simpler one will be those who are joining us online. We should have 16-bit, Ikurai, Better Medicine, and OnCoustics on screen with us.
Can you all hear and see us, the online people? Are we to
All
the
right,
backstage
yes.
crew? We've got everyone online as well.
Great stuff.
That's good. Okay, so we're going to start off with the live people who are here now. And it's really one of the most stressful and challenging parts, where you've got to pitch once again to remind us and our judges the true value of your solution in 15 seconds.
Yes, and
Yep.
indeed. And this is important because, of course, as you all know, in the real world, sometimes that's all the time that you have. To ride up a 15-second ride up in the elevator, and that's why it's called an elevator pitch. And so this few seconds can really make all the difference, and it's up to you all to capture the value of your solution and the attention of the audience.
Okay, so we'll pass the mic after you finish
right.
your 15 seconds, all right? Don't hold the mic back. No holding on to the mic. All right, so if you're all ready, let's begin. All right, let's start off with AI Medical Services. Over to you.
Hi. As you understand, cancer is the most difficult and also the number one cause of the death in Singapore. And the only way to find a GI cancer is going through the endoscope and looking for tissue detection. And we believe AI can
15
support
seconds is up.
yeah, we can believe on AI will supporting the physician and us. And the physician has a long life to support for the patient.
We have to pass the mic on. All right, over to Jess.
Thank
Justin
you.
from Jens. Yes.
All right, keep it tight, all right?
All right. And do begin now, please. Yeah.
Right. So at Jens, we have an AI portable screening device. It's essentially a belt that we wear around our liver, lungs, and kidney. It's 1 minute. It doesn't require any medical training, and it is very cost effective. So thank you.
Thank you.
All right,
Well done.
over to you, Junfai and Gyro
All
Gear.
right, thank you. Good morning. So 200 million people around the world have incurable hand tremors. This is a problem that's not been solved in the last 40 years, typified by Parkinson's and essential tremor. And currently there are no viable solutions. So what we do is that we bridge the gap between medications and the terrible side effects together with brain surgery. And we're working with all these sort of top centers, Harvard, Mayo, etc.
Time's up.
All right, thank you very much.
All right. Over they're not keeping the time. Lifescapes, let's give it a good try. Yes.
Severe paralysis, once thought untreatable, can now be restored through our BCI technology. Together with healthcare ecosystem, we aim to build a new rehabilitation model that empowers patients and providers. Thank you.
Thank you very much. Knowledge Genetics, your time begins now.
8% of hospital admissions are caused by adverse drug reactions, and what looks like for patients is that it takes years to find the right medication for them. We are here to bring this at scale in Singapore with existing partnerships, and we're looking forward to partner with you.
Thank you. On the dot. And NDR, Alan?
When diagnosed with cancer, to treat or not to treat is a life and death situation. And that happens to me, to my mother, a couple of months ago, that I have to make the decision whether to treat her with surgery. When my mom asked me how many months has she to live, I really teared. I'm Alan Goh from NDR Medical. Please support us for pre-consultation and as well as AI surgical treatment.
Thank you.
Thank you so much.
Support Alan and his mother.
Yes.
All right.
All right, let's move our sights to the screens and focus online. Let's have 16-bit to kick us off.
Thank you. Singapore's aging population will make osteoporosis an undeniable burden, and current screening will not suffice. The bold leap required is opportunistic screening with AI, detecting disease earlier, seamlessly, and at scale. With Roe, Singapore can deliver tomorrow's care today. Let's take that first step forward together.
All right, just a slight little overrun, but thanks, Alexander. And next we have Akurai.
Akurai is taking an invasive procedure that we know improves heart failure patient outcomes and making it non-invasive. This enables more heart failure care to be done in the community, reducing the overall burden of heart failure patients on the healthcare system, helping us make a shift from reactive and episodic care to preventive and personalized care.
All right, thank you so much, Philip. And let's next have Better Medicine. Fred, over to you.
We help with early detection of less common underserved cancers, like kidney, liver, or pancreatic cancers, that are often discovered incidentally or simply too late. We make sure that no patient is left behind and doctors have the AI support they deserve.
Thank you so much. And last but not least, we have Beth from Acoustics.
Acoustics has created a unique machine learning platform that mines the raw sound signal in ultrasound, enabling us to create a virtual biopsy platform that will democratize access to healthcare, beginning with liver disease.
Thank you so much.
Fantastic. A round of applause for all of them. And I think we realize how difficult that 15-second pitch is. All right, finalists, you've presented us with really remarkable solutions. Congrats to all of you. But before we reveal the winners for today, I think we have to hear one more time from our judges. They spent a long time in that room there, and many interesting insights were derived. We must be interested to find out what happened in that undisclosed location. Can we go through some of your thoughts, please? So,
all right, and let's start off with hearing from Hyang Kun about 16-bit. Hyang Kun? Yeah, 16-bit, that's right.
Hello, hi. I think the initial thinking that we have about that really is about how you interface with the current screening strategy. That is not well. I think that's key to how we weave into the current workflow that we have, the funding model that we have. It does take a full value chain to enhance the value of what 16-bit can deliver. Thanks.
Sure.
Thank you very much. And Kirk, what did the judges think about Acurai?
Yeah, Acurai attracted the most comments and took the most time. Whether that's good or not, we'll find out later.
No spoilers. Yeah.
Yeah, but I think all the judges agree that it's got high potential, and I haven't heard the word that it can deliver on its promise like a holy grail, because it's easy to use, non-invasive. It can be deployed in many settings. But I think it's, like earlier comments, it's important to provide more validation and in more diverse populations.
Great, thank you.
All right, thank you. Next up, Emmerich, if you could share some of your thoughts about AI medical service.
This way, yes.
I think
you get the mic
mic,
on.
yep.
Yeah, sorry. Yeah.
Very interesting and promising technology. I wish I'd had an answer for the question on how many false positives there were. maybe one day, and look forward to seeing how it can be applied to other mucosal surfaces. Thank you very much.
And next would be Casey. What are your thoughts about better medicine?
I think the solution that was provided is something that we need for our patients. But I think as we look at all the different solutions being coming up from different sectors, we will need to look at how to better use the technology that's coming up and to tailor that for our needs of the population.
Okay, great.
Thank you so much.
All the judges not revealing too much yet.
Yes, that's good. And Chewy, over to you. Maybe you want to share about Jen's technologies.
Hi, Justin and Jen's team. First of all, I think your solution is a very innovative one, and I think it also comes with a lot of strengths, as what your pitch has shown, including some of the clinical validation studies that you have been doing in Hong Kong. I think on hindsight, we felt that there was a little bit of a missed opportunity where the discussion focused a lot more on the liver use cases, but perhaps not on the lung as well as the kidney use cases, where perhaps the results might actually be better. I felt also that to Hyang Kun's point about diversifying the potential users beyond just screening into follow-up, this potentially could be something that the team could also follow up on as well.
Thanks, Chewy. And Imrik, over to you for gyro gear.
Okay, I'm a hand surgeon. And I think the technology is very interesting. I know that you're working with Harvard, Mayo, and everybody else, but I would encourage you to work with NUS, which is a top 10 university in the world. As far as your pitch is concerned, you need to move from Kickstarter gadget style to actual data, and I think that it would benefit a lot from just simple trials and studies. So I think that's an important move to make.
Well, I'm a hand surgeon, never sounded so threatening, but right.
All right, Kirk, back to you. I think Livescapes would love to hear your views as well.
Okay. Yeah, the judges were happy that that's a new option in a landscape that has relatively limited choices, and are impressed by the fact that there's potential to improve function in such a short time. But there's some concerns about more clarity on the cost and how long each session would take. And some of the suggestions would be to gather more evidence on longer term impact and then to explore the potential to expand beyond hand rehab.
Thank you, Kirk. And next, knowledge genetics. And Glenn, could you fire your questions and tell them about your thoughts, please? No more questions, just thoughts. Sorry.
Back to the starting statement about diversity, only lady on the stage. Well
yes.
So I think the judges feel favorable and positive about presentation. You listened very well, you answered very well. Some thoughts needs to go into about how the services will integrate with existing lab services that sits in all acute hospitals today. And personally, I will not take it lightly, the complexities of integrating with existing LIS systems. Yeah.
Great, thank you, Glenn. Hyang Kun, over to you again. Some thoughts perhaps for NDR.
I think similar for NDR. You're providing a solution for a specific disease. And I think the complexity lies in, again, integration with the EMR system that you need to pull out to present. So good solution, but I think there will be challenges.
And finally, Casey and acoustics.
I think the judging panel looked at the solution, and we wanted to see how it has a competitive advantage against established methods for detecting or screening for fatty liver. So that's one point. I think there was quite a fair bit of potential in the solution for other areas in the liver in terms of diagnosis of other conditions. So I think that's something that should be explored further. Thanks.
Right, thank you. I hope Beth, you heard that? Okay.
Yes, I'm sure.
All right.
And we have heard from all the judges. Thank you so much, judges. And I'm sure those insights will be quite valuable to the finalists as well. For now, I'll just invite you to return back to your seats even as we prepare to unveil the winners for CHISEL InnoMatch 2025.
Okay, we've got 3 categories of winners: the Audience Award, the CHISEL winners, and also Slingshot, of course.
Yes.
All right, so let's start with the Audience's Favorite Award. And we are going to give you your last 20 seconds to tap on that vote button and see who we end up with as our audience favorite.
And keep those votes coming in. Okay, we are just moments away from revealing the audience's favorite award choice. And maybe we'll do a countdown together. Let's start from 5, 5, 4, 3, 2, 1. Wow, okay, it's a clear winner there. Gyro Gear. Woo!
Congratulations, Gyro Gear. Can we invite you up on stage?
Come.
Yes, and right, thank you. Congratulations, crowd favorite throughout the whole competition.
Yes, and congratulations.
Congratulations. Congratulations.
Congratulations.
Yeah.
Yes. Well, let's hold it together and perhaps we just take a quick photo. Yes. All right, great. Ladies and gentlemen, your crowd favorite.
And now it's going to be the winner for Slingshot 2025's Top 60 Fast Track Award. So once again, this company will be winning a $50,000 grant prize and also get a fast track to Enterprise Singapore's Slingshot Top 60 Finals. So let's welcome back Ms. Tong Sok Yue, Deputy Director for Health Environment from Enterprise Singapore, to join us on stage to give that prize out. And we've got the envelope here. All right. The company that will go on to be fast-tracked to Slingshot 2025 is Nala Genetics.
Woo!
Please
Come on up.
board.
Yeah.
Yes. Thank you. All right.
Congratulations.
Congratulations. All right, great.
All right, thank you so much.
All the best for the October competition. All right, let's wish them all the best, please. Great.
Okay.
Thank you, Sok-Yue. All right. Okay, and next, it's the time that we've all been waiting for. Yeah, this one? Yes, all right. Let's now call upon the winners, right, for CHISEL 2025. And as you know, they will be paired to the 3 clusters. Our first cluster to be paired with would be NHG Health. So let's call onto the stage Prof. Casey Tang. Welcome, Casey. This way, please. And we've got the winners here as well. Okay, so the first company that will be paired, first of 2 companies.
Well, we'll have the board first. Yes.
That will be paired with NHG Health. All right, that's that blank space there. So who's going to fill up that blank space? Is 16-bit.
Woo!
Okay, 16-bit. You're not here, so we'll put this for you. All right. I'll temporarily represent 16-bit. Yes.
Thank you.
All right.
Thank you, everybody.
Congratulations.
We have you on screen,
There they
so
are.
we'll take a
All right.
picture on screen with you.
All right, thank you.
you.
Congratulations, 16-bit. All right. Casey, can you bring us each
we have one more?
All right, can we have the board again for
Yes,
our
please.
second winner? let's have the board again, please. Yeah.
Okay. Yes. Yes.
All right, here you go.
And for the second company that will be paired with NHG Health for CHISEL InnoMatch 2025, and that is Ikurai. Congratulations. Ikurai is also online, so we will be...
Your turn.
Yes, my turn. Okay, we've affixed the logo and we'll take some pictures.
Congratulations, Philip. All right.
Thank you so much.
Thank you.
Thank you.
Thanks, Casey.
Thank you, Casey. All right. All the best to 16-bit and Ikurai as they continue their journey with NHG Health.
That's right.
All right, over to you, Casper, for our next cluster.
All right, and up next, we will be presenting the two solutions that will be paired with NUHS. And with that, we invite Professor Emerick Lim, CEO of National University Hospital under NUHS, to be on stage. And can we also have that?
Yes, there you go.
All right. All right, and the first company that will be paired with NUHS is GyroGear. Congratulations.
They'll stick their logo onto this. Yes. Congratulations. A round of applause for GyroGear, please. Crowd favorite and CHISEL winner.
Exactly. Thank you so much.
Congratulations, gentlemen. All right, great.
Emerick, we'll just have you hold the second board. And for the second company that will be paired with NUHS, it is Lifescapes. Congratulations. Thank you so much. Thank you, Emerick.
Thank you, Emerick. Congratulations again. Congrats. Thank you. All right. Again, all the best to GyroGear and Lifescapes as they continue their journey with NUHS.
That's right.
And now, the final cluster, Sing Health. And which are the two companies that will be paired with Sing Health? Hyang Kun, could we have you back on stage again, please? Thank you. All right. This way.
Hyang Kun, just have you hold this for a while. Thank you.
Now, the first of two companies that will be paired with Sing Health, once again, Ikurai, double winner. All right. That's me again. Okay.
Wow.
That's great.
All right. Thank you.
Congratulations, Ikurai. You should have flown all the way here. It would have been worth it.
Correct.
Okay, fantastic. And now, the second company to be paired with Sing Health, AI Medical. Yes.
Take a picture first.
Okay. Thank you. Thank you.
Thank you.
Congratulations to the winners. Yes, they'll take it back. Yes.
Thanks, Hyang Kun.
And thanks, Hyang Kun. Right, 6 wonderful marriages have been confirmed today. Let's wish these marriages all the best.
Exactly.
I know how marriages can work out sometimes, but we wish them all the best. All right. So, to all the finalists, everyone here, and everyone online who shared your solutions today, great kudos to you. There's been a huge amount of courage that you've demonstrated to join this challenge and pitch your solutions. And for the finalists who didn't get paired with your clusters, I don't think your journey is going to end today.
Correct.
We hope that your participation in CHISEL has exposed you and given you more opportunities as well.
Yes.
May more doors open for you.
That's right. And please do keep in mind that the 10 companies that are featured today were chosen out of 500 over interested companies. So please keep pushing forward, and I believe you'll be rewarded for your hard work. Come on, let's give them another round of applause.
It's time for thank yous. This couldn't have happened with a lot of help from our partners. First and foremost, we have to say thank you to Temasek Foundation and the Ministry of Health for their generous support all these years. Without their contributions, we wouldn't be here at all in the first place.
That's right. And we also couldn't have done it without the partnership of our healthcare clusters, who are the ones who will be taking on the test bedding of these solutions. So NHG Health, NUHS, and Sing Health, and of course, a community partner, Tai Hua Kwan Moral Charities. And they have also provided reviewers, coaches, and of course, our wonderful judges that you see here in front of you. And we will also not forget our partners from the Agency for Logistics and Procurement Services, ALPS for short, the National Health Innovation Center, NHIC, and of course, Synapse.
A big thank you to also our outreach partners and agencies. This huge number of people came together. It took a whole innovation village to make this possible. So thank you very much for making CHISEL reach a global audience.
That's right. And lastly, to all of our exhibitors, as well as the audience members here, thank you for joining us today. Because by joining us, you're also showing us your commitment towards innovation and excellence, and that is truly inspiring. And we are very honored to have you also part of this community with us. And before we wrap up this incredible event, we would like to hear from you as always. We'd like to invite you to participate in our survey by scanning the QR code on screen. This is very important to us because year on year, we would rely on your feedback and inputs to make CHISEL even better and bigger for the next year.
So that's going to bring CHISEL InnoMatch 2025 to a close. We look forward to seeing all of you next year, when CHISEL InnoMatch 2026 will focus on enhancing health through AI and tech-enabled workforce. So that's maybe the key word that we have for all of you. All right?
That's right. So once again, thank you to all our participants and audiences joining both us here physically as well as online. Give yourself a round of applause for staying through all the way to the end.
Right.
And this is goodbye from all of us here in CHI.
See you next year. Bye-bye.
See you.
Great.